through. So starting earlier, I think will be beneficial for everybody. Questions should be better, discussion should be better, people should be less tired, less hungry, all those things. So that's the goal. That's the goal of the meeting. Just a couple of quick reminders before we jump into the meeting, and that is anyone participating on Zoom, please keep your phone or your microphones rather on mute unless called upon to speak. Those participating by phone, keep the phone on mute at all times unless called upon to speak, and do not put the phone on hold. And please avoid using speakerphone when speaking. Please speak directly into the device's microphone or your telephone receiver. I'm now going to ask the board secretary to conduct the roll call.
Member Banham?
Present.
Member Coutier? Vice Chair Di Giovanni?
Present.
Chair Eglai?
Here.
Member El Chantieri?
Present.
Member Gower?
Here.
Member Kavanaugh?
Here.
Member Lakin?
Here.
Member Menard?
Present.
Member Pinel?
Présent.
And Member Tilley?
Present.
You have quorum, Mr. Chair.
Very much. No regrets were received. So again, some further procedural notes before we start the substantive meeting. The following procedure guidelines are being implemented to promote orderly proceedings of this virtual meeting. First, on the issue of attendance. Should members need to leave the meeting, they should advise verbally that they are doing so before clicking on leaving the meeting from the Zoom platform or ending their call if participating by phone. In terms of speaking order, I will provide each member with the opportunity to ask questions or comment. Members will be called upon to speak in the order or reverse order as set out in the board secretary's voting list. The usual 5-minute limit will apply. Should you not wish to speak on a given matter, you may decline verbally when your name is called. For voting purposes, if a full recorded vote is not taken for a given item, I will specifically ask if the item is carried, and then call for dissents to ensure that all votes are properly registered. Points of order, privilege, or challenge. Procedural interjection should be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order, where you have not been called upon to speak, please state your name aloud and for the record before stating your point of order. Should technical difficulties or other unforeseen matters require a recess during the course of the meeting, unless the board secretary issues new instructions, members are requested to remain on the line. The board secretary will mute all participants in such an instance. Members and meeting participants will also note that we are testing the Zoom captioning feature for tonight's meeting. Though it may not perfectly capture everything said during the meeting, this is being piloted to provide added accessibility for those who may have difficulty hearing. Are there any declarations of interest for this meeting? Okay, seeing none, thank you. We'll move on to the confirmation of minutes of the meeting of June the 21st, 2021. Can we confirm those, please?
Okay.
Thank you.
Okay.
We have 10 communication items that have been received, and they're held on file with the Board of Health Secretary, and they are as noted in the agenda. I'm going to call upon Member Kavanaugh to please move the motion to introduce reports.
Okay, I got it.
Oh.
Okay, be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health report, and the reports entitled Reconciliation Action at Public Health, A Time of Reflection, Refresh, and Reinforce Commitment, Ottawa Public Health's 2019 to 2022 Strategic Plan, Strategic Priority Relating to Mental Health and Substance Use Health, Update on Ottawa Public Health work to support schools through COVID-19 and beyond, Ottawa Public Health Post-Pandemic Recovery Planning, Ottawa Public Health's Strategic Plan for 2019-2022, Update from Q2 of 2021, Office of the Auditor General, OAG, 2021 Interim Audit Work Plan and Proposed Audit of the Pandemic Response, 2021 Operating and Capital Budget, Q2, Board of Health for the City of Ottawa Health Unit Status Report, and Performance Appraisal of Medical Officer of Health in camera, personal matters about an identifiable individual reporting out date, not to be reported out, be received and considered.
Can we carry that?
Carried.
Carried. Thank you very much. I'll now go through our consent agenda process. For those participating or watching from home who may not be familiar with this process, I will list each item on the agenda, and for any items where board members don't have any questions or concerns, and we don't have public delegations registered to speak, the board may carry or receive those items on consent, which is to say, without any discussion. So first is my verbal report. So we'll hold it for the report. That is followed by Dr. Etch's verbal report, which will also hold that item. Next is our reconciliation to Ottawa Public Health, the time to reflect, refresh, and reinforce commitment. We are going to hold that both for staff and guest presentation. Next is Ottawa Public Health's 2019-2022 strategic plan, strategic priority relating to mental health and substance use health. We have both staff presentations and a number of public delegations, so we'll hold that. Next is the update on Ottawa Public Health work to support schools through COVID-19 and beyond. We have no presentation here and we have no delegations. Can we receive this report?
Received.
Received, thank you. Next is Ottawa Public Health post-pandemic recovery planning. Again, no presentations, no delegations. Can we carry this report?
Carried.
Okay, thank you. Ottawa Public Health strategic plan for 2019-2022 update from Q2 of 2021. Can we receive this?
Received.
Thank you.
Received.
Office of the Auditor General 2021 interim audit work plan and proposed audit of the pandemic response. Again, no presentations, no delegations. Can we carry this matter?
Received. Carried.
Thank you. 2021 operating and capital budget Q2 Board of Health for the City of Ottawa Health Unit status report. May we receive that?
Received.
Thank you.
Received.
Performance appraisal of a medical officer of health in camera, personal matters about an identifiable individual, reporting out date, not to be reported out. Can we carry this matter, please?
Carried.
Yes, thank you very much. So we'll go back to the agenda now and respond and deal with the matters that we have held. First up is my verbal report. Good afternoon. Kwe, Inyai, Tanshai, bonsoir. I'd like to begin by honoring the Algonquin Anishinaabe Nation, land and people. Ottawa is located on the unceded territory of the Algonquin Anishinaabe Nation and is a gathering place for many Indigenous people. On behalf of the Board of Health, I would like to honor the land and the peoples of the Algonquin Anishinaabe Nation whose ancestors have lived on this territory for millennia and whose culture and presence have nurtured and continue to nurture this land. I would like to extend that honor to all First Nations, Inuit, and Métis peoples, their elders, their ancestors, and their valuable past and present contributions to this land. Next week on September the 30th, we will be observing the first National Day for Truth and Reconciliation. This is an opportunity to bring awareness to the painful legacy and impacts of the residential school system, which is especially important in light of the discoveries of unmarked grave sites at former residential school locations this year. It is also a time to advance our reconciliation efforts to build a better future for everyone in our community. For the past 19 years, Ottawa Public Health has actively been involved in the Ottawa Pride Festival. OPH continues to work alongside the 2SLGBTQIA+ communities to ensure access to welcoming, safe, supportive, diverse, and inclusive environments, free of stigma and discrimination. Again this year, OPH partnered with the community and social services to honor Pride Week in Ottawa with the Pride flag raising ceremony at the Mary Pitt Centre. The event was live streamed on YouTube and allowing the community and employees to participate virtually. As chair of the Ottawa Board of Health, I was proud to be there and take part in the ceremony. Of course, no Pride Festival is complete without a fun and colorful parade. Once more, we were able to participate by submitting a short video highlighting our support to the community. I want to thank OPH staff and board members who were able to be part of that fun activity. On August the 31st, Ottawa Public Health attended an event held at the Human Rights Monument outside of City Hall to recognize International Overdose Awareness Day alongside people with lived and living experience. Their families and friends, service providers, allies, community partners, and city partners, including Ottawa Paramedic Services and Mayor Jim Watson. Overdose Awareness Day is globally recognized in efforts to reduce stigma and harms related to substance and drug use. Time and time was taken during this event to acknowledge the grief felt by families, friends, and the harm reduction community of those lost. Locally, nationally, and globally, we remain in a worsening overdose crisis that has been exacerbated by the COVID pandemic. Sadly, the opioid crisis continues to take lives across Canada. The presence of a toxic drug supply persists, and stigma remains a significant barrier to accessing much needed services and supports. OPH and its partners are dedicated to learning, adapting, creating, and providing barrier-free services.
To the Ottawa.
OPH's work regarding substance use and mental health has been ongoing and remains a top priority. OPH continues to advocate for systemic changes to be made at all levels of government and supports efforts to amend government policies to make all necessary resources available. OPH continuously strives to learn more and do more to advocate for the needs of people with lived or living drug use experience, reduce stigma, remove barriers to accessing services, and promote harm reduction philosophies and principles. This knowledge is used to work towards a society where no one is forgotten or denied the care that they need. Last week, Dr. Etches and I were honored to participate in a two-day dialogue about drug policy in Ottawa. The event was part of a Getting to Tomorrow, Ending the Overdose Crisis, a National Health Canada funded public health initiative aimed at surfacing solutions to the overdose crisis by bringing communities together to build a consensus and a shared understanding for change. The local event was led by the Drug Users Advocacy League and Sandy Hill Community Health Center and included many community leaders and stakeholders from a diverse range of sectors, including people who use drugs and people in recovery, youth, families, health professionals, representatives from all levels of government, police, First Nations, Inuit, and Métis organizations, faith leaders, media, political leaders, and more. It provided an opportunity to come together as a community to talk about the impacts of the unprecedented overdose crisis here in Ottawa and across the country, and to discuss how we can advance a public health and human rights framework to respond. We look forward to continuing this conversation and moving forward with the actions we heard were a priority for improving the substance use health and wellness of Ottawa residents. I'd also like to point out that Member Banham also attended the two-day discussion, as did a couple of councillor colleagues, Councillor King and Councillor McKenney. This past Friday, September the 17th, Ottawa Public Health took part in Recovery Day Ottawa, which is an annual community event organized by the Community Addictions Peer Support Association, or CAPSA. The purpose is to help reduce stigma surrounding people living with substance use disorders and to raise awareness about substance use, health, wellness, and recovery in the Ottawa community. OPH works alongside CAPSA, partners, and community members to help support individuals and those around them in all aspects of recovery and well-being. The pandemic has exacerbated many challenges in our community, in particular the harms related to substance use. In Ottawa, we continue to face barriers caused by stigma that surrounds substance use health. To address these barriers, OPH is proud to be partnering with CAPSA and other partners such as the Royal, CHEO, the Ottawa Hospital, and many more to continue to take action on reducing stigma through the Ottawa Community Action Plan. Recovery Day Ottawa endeavors to engage the broader community by building partnerships with local, provincial, and national organizations, and to raise awareness through the hashtag Stigma Ends With Me campaign. OPH is committed to continuing this work alongside CAPSA, those with living experience, and the many community partners. As many of you know, on September the 2nd, Dr. Etches informed all Ottawa Public Health staff that OPH's employee immunization policy had been updated to include a requirement for all employees, volunteers, contractors, and students to be fully immunized against COVID-19. Similarly, on September the 3rd, 2021, the city's general manager, Steve Kanalakis, informed all city employees that the City of Ottawa would be implementing a mandatory vaccine policy requiring all employees, contractors, students, and volunteers to be fully vaccinated against COVID-19 by November the 1st, 2021. OPH has consistently expressed support for policies that increase immunization coverage in our city and has been supporting employers in developing and implementing their own workplace vaccination policies as part of their COVID-19 safety planning. We have consistently said that vaccination is our best way out of this pandemic and that we must do all we can to encourage uptake. I asked for and received a legal opinion that because OPH's and the city's vaccines policies are administrative, they do not apply to elected officials or appointees. However, I feel strongly, very strongly, that as the governing body responsible for public health in Ottawa, our board should lead by example. At the September 8th meeting of City Council, I was happy to second two motions put forward by Mayor Watson. The first to direct that the city's mandatory vaccine policy apply to members of council, and the second to ask council to approve that citizen volunteers appointed by council to its various governance bodies, including advisory committees, the Build Heritage Subcommittee, the Transit Commission, the boards for the Public Library, Ottawa Public Health, and Ottawa Police Services, and the Committee of Adjustment, be notified that those volunteers must provide proof of full vaccination or medical exemption prior to the resumption of the in-person meetings in order to take their seats at those meetings. I'm also very pleased to share that every member of our Board of Health has agreed to publicly disclose their vaccination status as an example of leadership befitting our collective role in overseeing the provision of public health services in the City of Ottawa, and that all members of the Board of Health have been fully vaccinated for COVID-19. And I'd like to personally thank all members of the board for stepping up, getting vaccinated, and being open, public, and transparent about it, and in their support for further uptake of vaccinations in our city. I want to thank, again, all of you for demonstrating your leadership on this. I also want to thank OPH staff and our many volunteers for their continued efforts to increase COVID-19 vaccination coverage in our community. With various holidays and observances coming up in the next several weeks, many may be thinking about how to celebrate this year. We know that COVID-19 rates have been increasing in recent weeks and that the Delta variant presents an increased risk. We also know that being fully vaccinated significantly lowers your risk of serious illness from COVID-19, but it does not mean you're immune. Moreover, children under the age of 12 are not yet eligible for the COVID-19 vaccine, which means that they continue to be at a greater risk of infection. Therefore, notwithstanding our vaccination status, we must all continue to do everything we can to keep COVID-19 levels in our community as low as possible. If you're going to get together with a small group of friends or family over the coming days or weeks, remember that outdoors is much safer than indoors. And if weather stays the way it is right now, we can hopefully continue to stay outdoors for quite some time. Keep physically distancing and wearing a mask in situations where you can't maintain physical distancing. Keep up with your hand hygiene and stay home if you're not feeling well. This is important so that our children and youth can continue in-person learning and so that businesses can stay open and operate as safely as possible. I want to thank every Ottawa resident who has gotten vaccinated and everyone who continues to adhere to public health measures to protect themselves, their friends, and family, and our community as a whole. That concludes my verbal report, and I'd be happy to take any questions. I see no hands going up. Can we receive the verbal report?
Received.
Thank you very much.
Received.
Now going to turn to the second item on our agenda, which is Dr. Etch's verbal report. So I'll turn the microphone over to you, Dr. Etches. Thank you.
Good afternoon, Kwe, Ulakut, Tamshe, bonjour. I also want to recognize that we are meeting, I'm pretty sure all of us are on the unceded territory of the Algonquin Anishinaabe people. So and we'll hear more about that later. So just now, I would like to provide a brief update on Ontario health teams, highlight Environmental Health Week, talk a bit more about our employee immunization policy, and provide an update on the COVID-19 situation, vaccine rollout, and an update on all of the Ottawa public health initiatives that are aimed at keeping COVID-19 levels manageable this fall. So on Friday, the province announced 8 new Ontario health teams in the province, including 4 rivers. That covers West Ottawa, Arnprior, North Grenville, Carleton Place, and Elmont. So Ottawa Public Health is pleased to be one of over 60 partners, health system partners, that are contributing to this 4 Rivers OHT. And in its first year, 4 Rivers will focus on improving mental health and addiction services. So that's very aligned with Ottawa Public Health strategic plan and our recovery goals. This week is Environmental Health Week. It's a time to celebrate and recognize public health inspectors and others who work in environmental public health. These professionals ensure that they remain at the forefront of protecting public health by expanding their education. Their field is ever changing, and they are constantly collaborating with partners and colleagues. Ces professionnels veillent à rester à l'avant-garde de la protection de la santé publique en élargissant leur formation et en collaborant avec les partenaires et des collègues. So during these unprecedented times, environmental public health professionals, they've demonstrated their commitment to the health and safety of people in Ottawa by being flexible and adaptable. Some environmental health staff were assigned to the pandemic response, supporting infection prevention and control and outbreak management, and others continued to manage the wide range of essential services like food safety and water safety, health hazards arising from environmental contaminants, extreme summer heat, and infectious diseases such as rabies, West Nile virus, and Lyme disease. So environmental health is also a key aspect of our collaboration with the city to build healthy communities through a refresh to the city's official plan and the climate resiliency strategy. So I want to thank these professionals as public health risks change, for their dedication to informing the public of risks, promoting interventions and solutions to improve the health and safety of the community. So Ottawa Public Health is supportive of many policies that increase immunization coverage in our city, and that's why we were supportive of the province's announcement to require proof of vaccination for patrons and clients to access certain businesses and different settings. Santé publique Ottawa appuie les politiques visant à accroître la couverture vaccinale dans notre ville. C'est pourquoi nous étions d'accord avec l'annonce de la province d'exiger une preuve de vaccination pour les clients qui veulent accéder à certains commerces et établissements. This is certainly a week that businesses are going to have to figure this out. And so when it comes to businesses and workplaces, we are continuing to support them, working with our bylaw colleagues to answer questions about implementing the vaccination policy. And when it comes to supporting businesses and workplaces, we've also been strongly recommending that employers implement a workplace vaccination policy for staff. These policies do help protect employees by reducing the risk of COVID-19 transmission, help prevent outbreaks, and build confidence in the workplace. So to support this recommendation, we've released guidance on our website to assist employers in developing and implementing their own workplace vaccination policies. Employers do have a responsibility to maintain a safe work environment for their employees and support employees to get fully vaccinated. So of course, this applies to us. And so as the chair mentioned, on September 2nd, details were shared with all of our staff about our own updated immunization policy. And in creating an updated immunization policy, we considered the vulnerability of many of the clients for whom we provide direct services, the need to maintain our operations through a resurgence, the effectiveness of vaccination compared to relying on testing, and an ethical analysis. And so the updated policy does require all employees, volunteers, contractors, and students to have received a first dose of COVID-19 by September 15th and a second dose by October 15th in order to be what we consider fully vaccinated with that protection by November 1st. They will also be, we all, as me too, will be required to provide proof of full vaccination against COVID-19 using the same system that City of Ottawa employees will be using. So we continue to support people to access vaccines. Those who are not vaccinated will have to provide written proof of a medical exemption from a physician or a nurse practitioner. And employees without a medical exemption who are not fully vaccinated will be provided with information and required to attend an education session. Personal and or philosophical opinion won't be accepted for granting an exemption. And where people don't meet the requirements of the policy, we will have to assess on an individual basis what measures need to be followed as next steps. But it does include up to and including termination for non-compliance. So, it is something, of course, we would work very hard to avoid that kind of outcome. And why we're doing this is because we still have COVID-19 in the community. So I will just an update now on what we're seeing. In recent weeks, we've seen increases in the number of people testing positive for COVID-19. And there's been an increase in people in the intensive care units with COVID-19, although overall, our hospitalizations are holding steady. Ces dernières semaines, nous avons vu une augmentation du nombre de personnes testées positives pour COVID-19, ainsi qu'une augmentation dans le nombre de personnes aux soins intensifs, bien que le nombre total d'hospitalisation reste stable. So the level of virus in the wastewater has also increased slightly, and the number of outbreaks has gone up. So what we're aiming to maintain is a manageable level of COVID in the community through this fall and winter. And I'm very hopeful that with the high level of immunization protection of older adults and more vulnerable populations in our community, that we will not see the same level of serious illness as previously, even with the Delta variant circulating. While modeling has predicted a significant resurgence this fall, the people of Ottawa are keeping transmission manageable for the hospitals at this point. And I mention hospitals because they're working hard to catch up on the needed surgeries and procedures and avoiding further cancellations through the fall and winter when respiratory viruses typically increase and put pressure on hospitals. It's important for the health of our population. On September 1st, the Ottawa Public Health Epidemiology team began adding information on our COVID daily dashboard to provide the breakdown of people testing positive for COVID and hospitalizations by vaccine status. So the rate of new people testing positive among an unvaccinated population eligible for COVID-19 is 73 per 100,000, while the rate of new people testing positive among the fully vaccinated population is 6.5 per 100,000. So it means the risk of COVID-19 infection among that unvaccinated population eligible for a vaccine is 11 times higher than it is for the fully vaccinated population. This this figure changes depending on context. So the figure for the Ontario population is 8 times greater risk. Previously, I think we had about 15 times greater risk. And what happens is as a greater and greater percentage of the population is vaccinated, then when we have a certain level of COVID in the community, it will reach vaccinated people more often. But you can see the really significant protection that is provided by the vaccine, and even more so when it comes to serious outcomes like hospitalization or death. So we're continuing to make progress with vaccination coverage. To date, it's 82% of people born in 2009 or earlier are fully vaccinated. And this represents 72% of the total population in Ottawa. When it comes to first doses, we are up to 88% of eligible Ottawans who've had their first dose. And so I wanted to provide this update that as of Thursday, August 19th this year, daily operations for the COVID vaccination program transitioned from the city's Emergency Operations Center to an Ottawa Public Health Command Center led by Marie-Claude Turcotte. And so I just want to consider the tremendous leadership and contributions that Mr. DiMonte and the Emergency Operations Center with Ryan Perot as the incident commander. I want to pause to take a moment to thank them for their role in supporting Ottawa's COVID-19 vaccination program. It was from November 2020 through to this August that we worked so closely with the city's Emergency Operations Center on coordination and delivery of the vaccine program, the operation of the clinics. It was a huge undertaking with daily challenges and frequent changes in strategy and provincial direction. And I'm very grateful to everyone who contributed to this work. So I especially want to thank and recognize Mr. DiMonte and Ryan Perot for their leadership. I believe Mr. DiMonte is able to join us here this afternoon. I'm just checking to see if he is here. Good. And so Mr. DiMonte, both you and Ryan have shown tremendous leadership, and we navigated, again, really unprecedented times. It was critical, this emergency management expertise you brought to assist with very rapid vaccination rollout. Again, ever-changing environment. You have contributed, and led to the city of Ottawa being seen as a leader in vaccination. And so your leadership led to us administering a huge number of vaccines per day with over 11 clinics running at the same time, as well as neighborhood and mobile options. And so again, the support of emergency management and city departments, many city departments, was seen as key and critical to the success. And so I really want to thank you, especially also in the early days, for reaching into supporting long-term care homes and retirement homes to be vaccinated as soon as possible. And I'll give you a moment to say some words. Mr. DiMonte, we have a certificate for you and one for Ryan as well.
That's very kind. Thank you, Dr. Etches. Chair and members of the board, I want to thank you. And I want to also say it was a very positive experience working with you, Chair, on a regular basis, and Dr. Etches with her leadership and her scientific expertise to help lead us through this. Certainly was a team effort, and I accept your thanks on behalf of the city and a tremendous team that was supporting me, but more importantly, that we were able to help you achieve our public health goals. Yes, we are all very proud that together we were able to show the rest of the province how a team can work and achieve goals and be at the forefront. So with that, I just want to say thank you very much, and Godspeed to all of you with the important work you do as a board. Thank you.
Thank you, Tony. Thank you very much. I spent a lot of time with you over the last year, so much more than I thought I ever would. But and sometimes we're stressful and tense, but I'll always remember us swapping the stories about our COVID puppies, which were stress relief in both of our homes. But quite seriously, I echo everything that Dr. Etches has said, and on behalf of the board, just want to thank you and your team. Didn't matter what time of day, what day of the week, on holidays, not on holidays. You guys were always there, available, a voice of reason, very practical in all your suggestions and your actions. And the city couldn't have got to the place we're at right now without the good work that you and your team did. So a massive thank you to all of you.
Thank you.
Yes. It is hard to say enough thanks to so many who contributed, but take a moment. So, we're continuing the vaccine rollout. It is a goal to exceed 90% coverage, and that's work that means reducing barriers for accessing vaccine, and we're bringing the vaccine to where people live, work, pray, and play, and really supporting efforts to increase uptake again in people who are between 18 and 39, and in neighborhoods where lower vaccination coverage exists. Le travail se poursuit pour réduire les obstacles à l'accès du vaccin et pour amener le vaccin là où les gens travaillent, vivent, rien et jouent. Il s'agit notamment de favoriser l'adoption du vaccin chez les personnes âgées de 18 à 39 ans et dans les quartiers où la couverture vaccinale est plus faible. So residents have a number of options to access COVID-19 vaccine. There's no appointment necessary. Walk-ins are welcome at our 4 large clinics that are running 11 vaccine hubs, including 10 neighborhood and 1 African Caribbean Black vaccine hub. And there's pop-up clinics still. So pharmacies are key to providing vaccinations, and workplaces, community organizations, places of worship, other groups can request a mobile vaccine team to administer doses on their site at their own location. So this is done by completing a form on our website. We still welcome applications, and we're seeing that through this mobile option, first doses make up 40% of the doses given. And I want to thank all the partners who are hosting these kinds of vaccine clinics, supporting employees to get vaccinated, and supporting the work through the neighborhood hubs and reaching people that way. Again, in those hubs, we've administered so far just under 3,000 doses, and 43% were first doses. We're continuing to work with the long-term care homes, retirement homes with higher risk ratings. We've really worked to increase their capacity to administer COVID vaccines on site themselves and to increase employees' vaccine coverage. We're now supporting the 3rd dose immunization for residents within the 28 long-term care homes and 37 eligible high-risk retirement homes. And as of September 15th, it's about 25% of long-term care and 17% of the retirement home residents that have had their third dose. But by the 1st of October, we do expect the majority of residents in these homes to have been protected with a 3rd dose. And the Ministry of Long-Term Care has set a deadline for October 8th for homes to ensure that this is the case. So a couple more vaccine comments. Just that last Wednesday, the province did announce that eligibility for 3rd doses of the COVID vaccine will be expanded to additional groups, people with moderate or severe primary immunodeficiency, individuals receiving active treatment for significantly immunosuppressive conditions, and those with acquired immunodeficiency syndrome. So this will help further protect people who face the highest risk from COVID-19 where they have a weakened immune system. And so details about which specific conditions are covered can be found on our website, www.ottawapublichealth.ca/COVID-19 vaccine. And as the National Advisory Committee on Immunization reviews the evolving science about COVID immunity following immunization, Ottawa Public Health will adapt the COVID-19 immunization program based on provincial decisions about the strategy that's informed by the National Advisory Committee's recommendations. So Ottawa Public Health is preparing plans to immunize children ages 5 to 11 should approvals be achieved for COVID-19 vaccine this fall or winter. And the COVID-19 vaccination program will continue as the OPH team begins to distribute influenza vaccines in October, with both vaccines expected to be available in our clinics. In fact, we're also doing catch-up vaccination. We're offering the hepatitis, meningitis, and HPV vaccines to the public through our clinics as well. And so the influenza campaign I mentioned will first focus on people with the greatest risk for complications from infection, and then we'll launch the program for the general population. And so we're working with partners to provide access to the residents who face barriers, and we're making sure that everyone who wants the influenza vaccine will have access to it. So I will move on to the other work that Ottawa Public Health is doing to keep COVID-19 manageable this fall. Want to recognize that the best way to keep businesses and schools open and students in class for their health and their development is to minimize the introduction of COVID-19 into the school setting by keeping transmission low in the community. And so Ottawa Public Health continues to communicate with every resident who tests positive for COVID-19 to identify the locations they might have visited while contagious, to obtain a list of their close contacts, and provide information on measures needed to prevent any further spread of infection. Ottawa Public Health then notifies residents who are deemed to be a high-risk close contact of someone who's tested positive to provide them with information based on their level of risk. And the case and contact management team is working to grow their capacity again, following redeployment of employees to the immunization program and other core public health work over the summer. So we are able to follow up with about 90% of cases and contacts within 24 hours, which is the expectation from the province. And we're using automated notifications as well as a provincial and federal workforce supports to continuously expand our capacity. The prevention of outbreaks in healthcare and congregate settings has been a focus during the summer months, and we've worked in collaboration with the Regional Infection Prevention and Control Team to implement strategies involving outbreak preparedness site visits, additional education and training, and ongoing engagement with stakeholders. We are planning a further workshop, Outbreak 101, Community of Practice sessions for this month. And Ottawa Public Health's team focused on infection prevention and control continues to meet with other agencies like Ontario Health, Ministry of Long-Term Care, Home and Community Care Support Services, and the regional team to provide coordinated support to long-term care, retirement homes, and congregate settings. This is in line with the recommendations from the Long-Term Care COVID-19 Commission. We've enhanced our engagement strategies with partners. We're strengthening the prevention strategies, and we've improved our responses collectively, and we're very thankful for partners' commitment in this area. Ottawa Public Health is at this moment investigating 9 outbreaks and managing a resurgence of non-respiratory and non-COVID respiratory outbreaks and enteric outbreaks. So the current number of non-COVID outbreaks is lower, is 7 to date. But we are preparing to address more types of outbreaks this fall of all types. So in collaboration with city partners and Ottawa Inner City Health, Ottawa Public Health is providing ongoing support to people who are homeless and marginally housed by assisting agencies to reopen rooms and communal spaces. It's really important for people to have these options, and the startup of more services, like including mental health and addiction services, by providing advice around infection prevention and control. And the COVID-19 school support team has also been growing its capacity to support schools and prevent and limit COVID-19 transmission. That is further described in the schools report that I know you accepted, received. But I will mention that with students returning to classrooms, more people are completing the daily screening for COVID-19 symptoms and then seeking testing when symptomatic. And so the Ottawa COVID-19 Testing Task Force is closely monitoring this demand for testing to adjust assessment center capacity to meet the community's testing needs. And so Ottawa's labs and testing locations have increased staffing levels in anticipation of kids returning to school. The hospital partners and the testing task force are continuing to work with Ontario Health to increase testing capacity and streamline this testing space. So, we're seeing new innovations. The types of approaches that hospital partners are implementing and exploring include increasing the staffing and the hours to accommodate testing appointments daily. But they've worked with a provider to have pop-up testing on the weekend, and that's continuing at this moment. they're exploring self-serve kits being available on sites with the hope that they could launch this more broadly to the whole community. And they're exploring testing through community partners, actually, by, that's engaging primary care and community pediatricians to also be able to provide COVID-19 testing. And they're looking at extending weekend hours. So I am hearing over the weekend there were many no-shows where people had booked appointments but didn't come. And so that does also limit testing capacity. Then someone else couldn't book that spot. So just a reminder, if somebody has booked an appointment and no longer needs it, to please cancel it so someone else can use it. And I do expect further communications from the testing task force about how they're increasing capacity into the future. One more point on schools or children and youth. I do continue to receive questions about why there are limits to the mixing of different cohorts in school environments. Reducing interactions between cohorts is expected to minimize the risk of COVID-19 spread from one group to another, the cohorts. And it reduces the number of individuals who have to self-isolate at home when there's an exposure, and reduces the number identified as high-risk contacts. So a recent estimate was that there are about 43 people being named as high-risk contacts for each person that tests positive in school. So we need to continue to try to limit that, that number of people that need to be home in isolation after an exposure. And so, of course, in addition, masking and physical distancing between individuals continues to help reduce the risk of transmission. So Ottawa Public Health's monitoring this local situation about COVID in schools, every day, and we may recommend additional measures if the risk of COVID-19 infection or the disruption to students' learning from larger numbers of students being named as high-risk contacts grows. So I think, as the chair said, moving into the fall with caution still is key. In addition to getting fully vaccinated, choosing safer activities will be required to get through until a time when more of the population is immune. We will get there. But what it means is our communications team will be continuing to encourage people to gather in well-ventilated areas, especially outdoors, to keep gatherings small and to avoid large crowds where masking and distancing can't be maintained. So recognizing that these measures can feel hard to carry on with, I want to encourage everyone in Ottawa to keep reaching out to friends and family, get outside and keep active, and recognize that lives are being saved by the collective work that people are doing to keep each other well. Sachant que le maintien de ces mesures peut sembler difficile, j'aimerais encourager tous les citoyens d'Ottawa à continuer de tendre la main à leurs amis et à leurs familles, et sortir et à rester actifs, et à reconnaître les vies qui sont sauvées grâce au travail collectif que les gens accomplissent pour se maintenir en bonne santé. And knowing that the Ottawa Public Health team is working hard to keep COVID-19 manageable for a second fall, while increasing essential services that Ottawa Public Health normally provides, the Ottawa Public Health senior leadership team is also focusing on employees' well-being. And so our Wellness at Work team has launched a 4-week self-care challenge. You can join us in this challenge by posting photos of your self-care on social media. Let us know what you're doing to promote your own well-being during this time. And so while the latest COVID-19 numbers and modeling can cause concern, I am hopeful because we've seen Ottawa beat the odds before. We've seen Ottawa residents persevere and come together as a community while staying 2 meters apart to support one another. And the Delta variant's presenting challenges, but we've learned a lot in these last 18 months. We have the tools, the knowledge, and the resilience to get through this next phase. Cela conclut mon rapport verbal et il me fera plaisir à répondre à vos questions. Merci. Thank you, Miigwech.
Thank you very much, Dr. Etches, for a very comprehensive update. And especially want to thank you for talking about the testing and giving us a better sense of who's responsible for testing. Those decisions are made, and also that efforts are being made by many stakeholders in that field, if you will, to increase access to testing either by increased hours or innovating through take-home tests and that sort of thing. I think we heard over the weekend some issues around wait lines for testing, what have you. So it's very good to hear that that's been taken into account, and the group is looking at improving that situation in the city. So thank you for that update. I'm sure it was top of mind for many councillors. So or board members rather. We'll go to the list for questions first, and in reverse order, we'll start with Member Tilley, if he has any questions today.
No, but thank you, yes, for a very comprehensive update, Dr. Etches, and you too, Chair. Thank you.
Thank you. Member Pinnell.
No questions, but thank you for this very great presentation. Thanks.
Thank you. And Member Menard.
Thanks very much, Chair. Yes, I've got my hand up, and thank you for that presentation. That was helpful, and really appreciate you going into more of the testing logistics as well. That's the one thing I'm getting over and over again from people. We play a role, so does the Ottawa Hospital, so do many other players in the field, I guess, for the near future, because people are just starting school now. So kids are back. That's the biggest one. It's the parents with kids or guardians with kids that's the main concern. I'm not getting it from individuals so much or elderly folks. It is the children. So with regard to CHEO in Brewer, and then the excess site that was set up just this past weekend, I believe at McNabb, that was helpful, that having that excess overflow site. And what you mentioned about the cancellation of appointments, also very helpful, because I've been suggesting to people, even if you can't get in, you can always walk up as well. So that would help with in terms of people not necessarily canceling their appointments. There may actually be more capacity there if they walk up. So I was wondering if you wanted to comment on the walk up piece, but you look like you do. And then I'll go on with questions.
Sure. Yeah. Everyone wants to get to a place where there's a good match between demand and capacity. And some of the things that are being trialed take a little time for implementation, but that is the goal. And we actually did see, the ability of the system to provide more access to tests this weekend past compared to the weekend before. So I see the progress, but we are. We know that it is the children that people are looking for more support. So I think our partners at CHEO could probably describe in more detail what they're doing, but they are supporting people who may not have booked appointment or who are coming and there's a long line through different things. Like they're looking at exploring these ideas of take-home tests. That is still not like the walk-up is still not really recommended. Like I would start first with booking an appointment just to avoid the lineups. That really is what our partners built the systems to function well on. It was appointments, but there are these different trials that underway to also meet the demand if people appear. Yeah, and there's less capacity. And I would comment on our work
Thank
around the take-home kits too. Ottawa Public Health, I think I've mentioned previously, has 127 schools now where take-home kits are being provided. And the uptake actually seems to be very good for people with symptoms. So when someone comes to school and they realize they don't feel well, they are going home with a take-home kit and using it, returning it to the school, and we arrange the courier to take it to the lab. Where we're going to work on helping people access testing more is the high-risk contacts identified in a school are not always coming back to the school to get a test kit. So we're looking at how we can streamline that for people to build that into, let's say, the dismissal of people who are high-risk contacts. So I think that that's part of it. Each thing we try needs some people behind it, and that really is the rate limiting step right now. It's the people, in the health system, in all of our organizations that are stretched.
Can you walk me through that process? I'm a former school board trustee, and we have 4 school boards in Ottawa. We have 127 schools you just mentioned that have these test kits. I'm just wondering about process. If it's a school that doesn't currently have access to that take-home test kit, for example, what is the process from here for them to receive those in terms of timeline?
Yep.
And how would that proceed?
So we have about 300 schools, so we're in just under half, and we're looking at a couple of things. The goal has been to get to all schools, and the rate limiting step right now is capacity for courier, and also building in the system. Each school needs to develop their processes, and so that's underway. I don't have a firm deadline in terms of when we'll reach 300, but it is coming, and we did focus on schools where it might be harder for people to reach an assessment center. We are, also exploring whether or not people from nearby schools could access kits at a given school. But again, we can't always, speak for what's possible within the school environment. So it's an ongoing conversation. The take-home kits for those going to assessment centers, again, that's something where the assessment center staff and the hospitals are exploring who could be there to help people understand how to use the kit, and then on the other end, how do they get that back to the lab? So these are the more of the details.
Thank you. And is it OPH in terms of the school kits? OPH has the kits now, or are we waiting for more from the province, for example? I know you said we're waiting on some of the school processes themselves, which makes sense. But do we have them in our possession now, or is that something that we'll see in the future?
These are PCR tests, so it's just irregular swabs. It isn't a matter of supply of tests. For example, there's rapid tests. Sometimes people talk about that's a different supply stream. We are getting the supplies for PCR testing from CHEO, and then our Ottawa Public Health staff put them together and assemble them into a kit. So that isn't a problem.
That's great. That's very helpful. Would it be possible to get just a summary email of the various methods that are currently being employed and what is likely to come from staff? That I think would help me anyway with some of the requests I'm getting, and I'm sure other board members would probably, if they're getting requests, feel the same way. I'm wondering about the ID issue for a vaccine passport. And you may not be able to answer this, but I am wondering, because I received an inquiry from an individual about they're not challenging the idea of a passport in any way, but they're trying to figure out what will be displayed on it and how they can ensure that privacy is protected. And what they're indicating is that they have a child who is not a transgendered adult child who's not changed their legal name yet for complicated reasons. It's the plan and will be underway soon, but hasn't happened yet. The family's double vaxxed, but with vaccine passports becoming prominent soon, their concern is that the passports are in the legal name attached to the health card, and haven't been able to get a good answer yet from the province or OPH on how much information will appear once they're scanned. But if a name does appear, then it stands right now, they're worried about that child being outed when they leave the house. So I'm just wondering if you know more about that issue or how those passports may roll out in terms of identifying information.
Member Menard, if I can just, there was a memo released to council this morning by Mr. DeMonte on the passport, vaccine passport, and the sorts of ID that are going to be required to prove. So you may want to reach out to him on that. I don't know if Dr. Etches can speak to it, but there was a very fulsome memo that went out to all of council this morning on that very subject, and spoke to the rollout, spoke to the types of ID that would be necessary. It's quite, it appears to be quite broad as to what you can produce, to the effect that maybe not even picture ID, but just something that confirms name and birth date. Again, I don't know if Dr. Etches has anything to add, but that that memo might in fact answer all your questions if you get a chance to look at it.
Yeah, I don't think we do know exactly how some of these individual situations will be handled. I think we need to keep asking the province questions and working with them. But I know people are looking for, compassionate approach where there's a recognition not everyone has proof of ID. Huge population between 12 and 19 probably don't have proof of ID. So we do need a system that, can accommodate this. And we also have populations without a health card, First Nations, Inuit, or Métis populations that decided to have their information kept with Indigenous health service providers rather than in the provincial system. So there does need to be some flexibility for different ways of proving vaccine status. And so I think this is probably not all going to be settled in 2 days. But this is partly why we've been meeting with businesses to promote a compassionate approach. We're not looking for perfection, or we can't expect that everything will go easily. But we're not asking businesses to be enforcers on this, and we will get to a place where we have better tools. It's just that the province will be releasing them, and I don't really have more details from them at this point.
Thank you very much, Dr. Etches. That's appreciated. Thank you for your presentation as well.
Thank you, Member Menard. Member Lakin.
Thanks, Chair. Thanks, Dr. Etches. Fulsome reports. Just a couple of quick questions on the OPH preparation for rollout in kids of vaccination. Does OPH have any sense yet of the expectation of timing on rolling that out? And does OPH have any sense where the uptake, when the time comes, for children will be any different than it will be for grown-ups? Thanks.
So there's a saying in emergency preparedness to plan for the worst and hope for the best. I'm not sure this applies because the arrival of a COVID vaccine isn't the worst, but in terms of it arriving this fall in November, that does come at the same time as flu and maybe some third doses. And so, it would be a time where our vaccinator capacity might be stretched. And so we're planning for that just in case. We want to have a plan that allows us to provide a COVID vaccine for children as soon as we can. As soon as it's approved, if we have clearly a safe and effective vaccine, and it's here, in our fridges, then of course we want it out the door. So the Kids Come First partnership is really key for us in drawing on all the capacity, all the children serving health agencies. That's one partnership that will really help us. Working with schools and school boards as well. So this is all of the kinds of planning we have underway, and we think the uptake will be pretty good based on what's happened with 12 to 17, 18-year-olds. That right now, first doses in that population, 12 to 17, are at 91%. So I think this is outstanding. Actually, I really want to thank parents who made it possible for children and youth to get the vaccine and have that protection. It's making a difference in schools. And we think that, typically we would see with a new vaccine, you might, other childhood vaccines, some of them we reach 95% coverage rate for measles, mumps, rubella. Others, it's more around 75% coverage for something like the human papillomavirus. But we're living through a pandemic that's really disrupted children's lives, and I hope that when we have more information about the vaccine, that people will be able to evaluate that and see, if it's being recommended, that there's a reason. It's to protect children, and we'll see how the uptake goes. If people have questions, we'll be there trying to make sure people have all the information they need, as well as working with partners to make sure it can actually physically be given.
Thanks very much. I know that parents across the city and families around the region are eagerly awaiting, and I'm sure they'll support the rollout fully. Thanks so much. Thanks, Chair.
Thank you, Member Lakin. Member Kavanaugh, please.
Thank you very much for all the information. And thank you very much for the effort you're making in vulnerable communities that are harder to reach. I appreciate all the clinics that have been set up in Bay Ward, Bayshore, and even in my own community of Belltown, where there's been extra effort made, and I appreciate it. So, and I appreciate there's extra effort being made at some schools more than, off the bat, starting off with schools I would assume that are more vulnerable. So that's appreciated for the test kits, etc. So because we don't want those kids to miss any school now that they can finally go back. It's great. In terms of the flu vaccine, I would think we're still going to have the regular program, really big push. Do you think there'll be any questions? People get confused with the other vaccines, or special communications for people?
We will be operating to make both vaccines available through the fall, and we will have to clarify who needs which vaccine. The flu is recommended for everyone over 6 months, and then COVID would be smaller populations right now that are expected to have their third dose. But we think that our clinics will make it easier for people by having both vaccines available in them. But typically it is pharmacies and primary care that do most of the influenza vaccination. So again, we work with pharmacies, we're working with primary care offices to see how they'll be planning to deliver flu vaccine this year, and they are. I expect working towards, like, they're preparing themselves to give the majority of flu vaccine again this year. So not too different from last year.
Great, but they'll be encouraging people to be double vaccinated for COVID.
That is the idea. If we're immunizing someone, we wouldn't want to miss an opportunity to also give COVID if there's anything we can do about that.
Okay, all right. Thank you very much. It was a great update.
Thank you. Member Gower, please.
Thank you, Chair, and thank you, Dr. Etches, for the update today. I don't have any further questions this afternoon.
Okay, thank you. Member El Shantiri.
Yeah, thank you, Mr. Chair, and thank you, Dr. Ashes. A couple of small questions, Dr. Ashes. When we talk about the kit for the small businesses to have their plan of vaccination, in the past, the province will define the small business 50 staff and over, or 50 and under. And is there a define? Because I'm concerned about the small businesses, the mamas and papas place with a couple of part-time employee. I don't think they have the expertise on staff or even the financial to be able to hire somebody. Is there a kit public health can provide those small businesses so they can follow on it?
We do recognize the diversity of businesses. So some larger organizations are developing their own vaccination policies. For smaller businesses, we've indicated it could be as simple as making sure that people discuss the vaccination and make it clear that it's recommended, and that they create time and space for their employees to go get vaccinated or go discuss getting vaccinated with the healthcare provider. And then we did provide some questions for employers to ask themselves about risk in their environment and how that might influence what kind of policy they put in place. And we did provide our vaccine policy as a template. And so we continue to be a resource for people. People can reach out to us and we can help them if they have questions about what's appropriate for their workplace. I think we wanted to respect that employers know their workplaces best, and so that things won't look the same at every type of business. Yeah.
So have public health define what's a small business, like how many employees you will have to have that.
No, we didn't. Our toolkit is generic, but in walking people through creation of a policy, it includes questions like that, like how many kinds of exposures you might expect, what kinds of risks there could be in the workplace, and it would be lower if it's a smaller workplace. The risk of exposures, would be lower often.
Okay, thank you. My other question is, with some holiday approaching us, like Thanksgiving, and people gather, and so, for example, if 10 family members, they're all double vaccinated, no children, no one in tendency is not vaccinated, you still have concern if that event takes place indoor with everyone being double vaccinated and follow the rules with hand wash and other.
Yeah, what we're encouraging people to do is choose lower risk ways of gathering, and you are right that making sure you're in an environment where there's good protection from vaccination is one way for it to be lower risk. The other ways to decrease the risk would be to spend more time where it's well ventilated, like outdoors, to use distancing, and to keep the numbers smaller so that it is possible for somebody to have a COVID infection after vaccination. They may be less symptomatic, might not be as transmissible, but if that happens, then fewer people in the gathering would be exposed if that was the case. So just following those general principles will help at a population level to decrease the bump up in transmission that we typically have seen from holidays. I do want to encourage people that what they're doing now in terms of limiting their contacts is worth continuing as we move through this period of more indoor activity.
Okay. Thank you, Mr. Chair.
Thank you, Eli. Vice Chair, please.
Thanks as always to OPH for all of your work around the COVID response. I know the City of Ottawa is greatly appreciative of all your efforts. And thanks, Dr. Etches, for summarizing the testing capacity. If I take off my board hat and put on my GEO hat, know that is a prime focus for us. And I think the way that OPH has facilitated lots of providers in the region coming together to look at a multimodal solution to expand capacity is really to be commended. We're in a much better position this year to do that than we were last year with the regional task force and looking at this across the city, which I think is better for our population to have testing out in different centers and different communities and not just centralized in one place across the city. So I think the ability for us to ramp up is much better than it has been. What we're all challenged with, I would suggest OPH, hospitals everywhere, is the health human resource challenge. It takes people to process, to take and to teach, and we are all strapped for people these days. But I wanted to commend OPH because I think the network in the community is much stronger because of the OPH efforts. And one of the strengths that I love about OPH is the ability to bring people together to rally to a cause and respond. And so I think that should really be called out in how that's been able to happen here. I actually don't have any questions, Chair, but really wanted to point that out for the committee.
Oh, and thank you for that. I mean, one of the all of our board members bring something to the table from their professional lives, and of course your role at GEO is very helpful in informing our group and keeping an eye on us as well. So it's appreciated. Member Kluche, have you sorted out your internet issues and have some questions?
With internet issues, thank you, Chair. Thank you, Dr. Etches, for the report. And indeed, this morning, the U.S. Administrator approved, or Pfizer provided some information with respect to its vaccine for 5 to 12-year-olds. In your experience, and I know it's speculative, if I could use that word, that the federal administrator in the United States will accept Pfizer's finding that it's effective and for children 5 to 12-year-olds. What would be the timeline for Health Canada? I think we're talking about, I heard November in the answers to other questions. Is that in accordance with past approval processes?
Yeah, I used November as a planning scenario for us to be prepared for that as maybe as early as we might expect, given the company has to submit its data to the federal government, Health Canada, and then that analysis would happen around approval, and then also at the same time the National Advisory Committee on Immunization would be reviewing what they would recommend for the use of the vaccine, and then the province will decide based on usually they have followed the advice of the National Advisory Committee, and so that process I don't know exactly how long that will take. It has been the case that things have moved along well because of the way I believe Health Canada has been accepting data as the companies go along, as they do their studies, rather than waiting for the final result. So that's why we've seen it move fairly quickly, faster than we had seen previously with vaccination approvals, because everyone knows we don't want an unnecessary delay. We just want to take the time to make sure the data is carefully reviewed. And so, I hope I can have more of a concrete update for you soon, but at this point, I don't have any specifics.
So we might get, our next meeting is on November 1st for the Board of Health, but we might get guidance from you prior to that, depending
Certainly,
on how.
I think a lot of people are looking for this kind of option for children. So yes, we'll communicate as soon as we know something.
I don't know if Mr. DeMonte is still on the call, but perhaps you could answer. 5 to 12 is a big segment of the population. I'm not sure what the percentage is. Can you give us any idea of supply if it's approved? And I recognize the logistics in administering and distributing the vaccine. Can you give us any idea of the supply situation?
No, I do not know what the federal government is got accomplished at this date in terms of, I don't know if you would call it pre-purchasing pediatric supply. I don't have any insight into that.
Okay, thank you. And just one last question, and it's with respect to the regular influenza vaccines. Are regular influenza vaccines given to children?
Yes, they are 6 months and older. Usually we recommend the influenza vaccine, and it's very young and older adults who are at risk of more complications. So priority populations, but anyone in Ontario can access influenza vaccine through the universal program for free. So that will be something we usually kick off in October. So we'll be promoting that more in October.
And has there been any research, any guidance with respect to the influenza vaccine and the COVID vaccine, i.e. can they be given at the same time in the same syringe, or at the same visit in 2 different syringes or 2 different deltoids?
So the mixing of vaccines in one syringe is not recommended. Would be surprised to see that. That's typically not done or recommended, but right now it's under review whether the 2 vaccines could be given at the same time in different places. And that I do expect, again, people know that's a time-sensitive decision. We're looking for that ahead of the launch of the flu campaign. And it would, again, be the National Advisory Committee on Immunization that will make a determination around co-administration of flu and COVID.
Co-administration, that will be the
yes.
word.
Yes.
Again, thank you to you and your colleagues and the whole team. for your continued work on behalf of the residents of the city. Thank you, Chair. That's all my questions.
Thank you. And last but not least, if she has any questions left after we've had quite a few, is Member Banham.
No, just thank you again to OPH. I feel like all of my colleagues have echoed that sentiment. Thank you for the very fulsome report and for all the work that you all continue to do to keep us safe, and no further questions.
Thank you very much. Our next presentation or item is item number 3.
Chair, can we receive the report?
Oh, I'm sorry, of course. Yes. Can we receive the report, please?
Received.
And that's why everybody needs a Deanne in their life, or else they forget stuff. So thank you, Deanne. Our third item is reconciliation at Ottawa Public Health, a time to reflect, refresh, and reinforce commitment. We're going to have a presentation by Dr. Sarah Funnell, and also a presentation, and I'm very pleased to have them here today with Barbara Dumont-Hill and her husband, Larry Hill, and they're going to present on public health actions to address anti-Indigenous racism. And we're going to handle the questions like as follows. So we'll let Dr. Funnell present, which will be followed by the Dumont-Hills. We'll then allow questions for the Dumont-Hills, and then we'll have questions for staff for Sarah and her team after that. Okay, so welcome, Dr. Funnell, and we'll turn the floor over to you.
Miigwech, Mr. Chair. I'm Sarah Funnell. I'm a First Nations public health specialist. It is my pleasure to work, live, love, and play on our beautiful traditional unceded Algonquin territory. Kwe, greetings, bonjour. We're about to approach the fall equinox, and what a better time to reflect, refresh, and reinforce our commitment to reconciliation at Ottawa Public Health. OPH is committed to reconciliation and aspires to become a culturally safe and humble organization. I'm here to provide you with an update on our progress. I will briefly describe the context and expectations for reconciliation, share some successes and lessons learned, and based on feedback that we've recently received from our First Nations, Inuit, and Métis elders and partners, I will identify a few recommended priority actions for the next 12 months. It is based on these ongoing conversations with Indigenous leaders and OPH colleagues and the evolving local, national, and global context that we are proposing revisions to the Ottawa Public Health Reconciliation Action Plan for your consideration. As we take the time to reflect, it's important to understand the context within which revisions to the OPH plan are recommended. Most notably, December 2020 marked the 5th anniversary of the release of the Truth and Reconciliation Commission's final report. From commissioners' perspectives, there are considerable concerns that meaningful progress on the calls to action have been far too slow. Other historic events include, but aren't limited to, legislation being passed in June on the United Nations Declaration of the Rights of Indigenous Peoples, meaning that a federal action plan is now required by law. Just before this occurred, unmarked graves of Indigenous children were discovered at former residential schools. More have since been discovered, and we can expect more. They are painful reminders of the systemic racism and health and social inequities that Indigenous peoples have endured and continue to endure in Canada, as documented during the COVID-19 pandemic. Anti-Indigenous racism was also in the spotlight as part of public rallies crying out for justice for Joyce Echaquan, a First Nations woman who was subject to racist attitudes and behaviors as she lay dying in hospital. As noted in a 2020 report about BC's health system, Joyce is not alone. And finally, the report on the National Inquiry into Missing and Murdered Indigenous Women and Girls report was released in 2019. As suggested by the title of this presentation, this is a critical time in our journey, a time to reflect, refresh, and reinforce our commitment to acknowledge the truth, take action, and ensure accountability. 3 elements of reconciliation that are considered for essential for meaningful progress to occur. The inaugural OPH Reconciliation Plan was created as a living document to respond to the health-related TRC Commission's calls to action, grounded in principles of reconciliation, respect, relationships, reciprocity, and reflection. It was validated by a group of local Indigenous elders in 2017 and approved by the Board of Health in June 2018. An evaluation framework for the plan was developed in collaboration with Indigenous consultants in 2019, followed by department-wide performance measures. Most of the proposed modifications to the original plan are minor. Given the current context, more significant changes include a greater emphasis on anti-Indigenous racism and new sections that address the missing and murdered Indigenous women and girls calls for justice, and OPH's annual performance measures and targets. While our reconciliation journey is ongoing, the pandemic has required some adjustments to planned activities and reporting expectations since June 2020. The next few slides will provide a snapshot of reconciliation-related activities since our last report to the board. OPH is attempting to raise awareness and understanding of colonial history, systemic racism, and its impact on Indigenous health through the following actions. As part of the COVID-19 vaccine rollout, the immunization program introduced Indigenous cultural safety training into the onboarding experience. 95% of new employees completed either one or both of the online learning opportunities, including a webinar on vaccine hesitancy and the implications for First Nations, Inuit, and Métis populations. In response to a Board of Health motion in June 2020 that recognized racism as a significant public health issue, OPH's mental health team developed an anti-racism, anti-oppression workplace policy to establish actions and expectations at the organizational level to identify and resolve racism, with a particular focus on anti-Indigenous and anti-Black racism. Preliminary discussions about the policy have taken place with First Nations, Inuit, and Métis partners. Additional conversations are expected to take place this fall to inform the policy's action and evaluation plans. OPH continues to share knowledge and lessons learned about Indigenous health with our health system colleagues, our city partners, community and academic partners, professional organizations, nursing and medical students through our existing networks, webinars, panel discussions, and other knowledge exchange avenues. We have also tried to promote Indigenous languages among OPH employees through an Indigenous Word of the Week submission to OPH's internal daily electronic newsletter. Taking the time to establish and maintain relationships when working with First Nations, Inuit, and Métis communities cannot be overstated. In particular, we are reminded by Indigenous elders and partners of the importance of reciprocal, long-term relationships that are built on the foundations of trust and collaboration. We have heard that OPH's relationship with local Indigenous organizations was strengthened over the past year as a result of the proactive support and guidance that OPH provided related to pandemic planning, including interpretation of COVID-19 guidelines and responses to clinical inquiries. Similarly, Indigenous partners have expressed appreciation for OPH's support during the COVID-19 vaccine rollout, had regular check-ins with partners that enabled ongoing communication and collaborative decision-making. Pre-existing relationships with the Ottawa Aboriginal Coalition and other Indigenous partners were essential to maximize outreach and provide timely community updates. This was accomplished by keeping OPH city and partner websites up to date, sharing regular electronic newsletters, social media posts, and more traditional targeted methods, such as media interviews, news releases, radio PSAs, bus ads, posters, and video messages. Having COVID resources available on OPH's website in some Indigenous languages was also seen as respectful. With varying levels of OPH support, Indigenous-specific COVID-19 vaccine clinics opened their doors to older adults in mid-February at the Akasivik Inuit Family Health Team Clinic and at Wabano Centre for Aboriginal Health. These clinics were designed to serve First Nations, Inuit, and Métis peoples, their household members, as well as employees of Indigenous agencies. Wabano and OPH also partnered with Tungasubignyat Inuit, TI, a pop-up clinic for Indigenous community members in the West End of Ottawa. Efforts to develop a culturally safe space included co-offering services with the Akasivik, Wabano, and TI employees, creating a warm, friendly clinic atmosphere. For example, Wabano arranged to have an artist in residence at the Saint Laurent complex. Indigenous artifacts were present in clinic spaces, culturally appropriate program resources were available, and a photo booth was set up to help promote vaccination. #BeGreatVaccinate. There is consensus that partnerships between Indigenous service providers and OPH contributed to a significant number of First Nations, Inuit, and Métis peoples receiving COVID-19 vaccinations. According to OPH data, over 33,000 doses of COVID vaccine have been administered through Indigenous-specific clinics. Feedback from clients who visited the clinics have been very positive and appreciative. This slide demonstrates a few comments from clients at Akasivik and the TI pop-up clinics. A First Nations community member who visited the Wabano OPH clinic wrote to tell us how much she and her partner appreciated their ongoing experience, going so far to say that it was literally the most positive experience we have had in public in nearly a year. Conversations with First Nations, Inuit, and Métis elders and partners reinforced several key messages for OPH to remember when planning public health programs and services with Indigenous communities. Some have already been mentioned, but in addition to those, it is understood that Indigenous communities know best what we need to be well. Respecting Indigenous rights, knowledge, and leadership is critically important to improve the health and well-being of First Nations, Inuit, and Métis community members, as well as adopting strengths-based, decolonizing approaches that are informed by communities. Recognizing and integrating Indigenous knowledge, these are ways of knowing and being, are considered protective determinants of health, such as language, land-based activities, and traditional healing practices. These are also recommended. Finding opportunities to engage and work with Indigenous elders and youth is also seen as a priority. OPH humbly acknowledges that we have a lot more to learn about moving forward in a good way with First Nations, Inuit, and Métis communities in Ottawa. In order for this to happen, OPH will continue to establish and strengthen relationships with First Nations, Inuit, and Métis elders, partners, and community members in a way that reflect the diverse voices within our communities. We will continue to adjust and strengthen our Reconciliation Action Plan, evaluation framework, and reporting mechanisms to ensure that we are being accountable for our individual and collective actions. We will continue to promote Indigenous cultural safety learning opportunities for OPH employees. The impact of this will be captured in quarterly team reports and as part of our annual employee performance reviews. And we will continue to support advocacy efforts to influence system change that are needed to effectively address the health-related TRC calls to action and the missing and murdered Indigenous women and girls calls for justice. For example, ongoing support for Indigenous-led research and actions to help end gender-based violence and anti-Indigenous racism. On that note, we are very grateful that Algonquin Anishinaabe elder Barbara Dumont Hill is joining us to share her knowledge, her story, and her guidance. Her words will inform and inspire our reconciliation journey. Good afternoon, Barbara. It is an honor to have you here today. Chi miigwech.
Barbara, you're on mute.
Sorry.
No problem. It happens to all of us at some point. Not a problem at all. Welcome.
Thank you. Chimigwech Sarah, your words are very powerful. I loved your presentation. When I reflect back on the incident that the board has asked me about on July 15th, I'm just a woman going to Lowe's to get some things for our yard, some plants, and with my husband, and I was in the store. Nothing really unusual happened, but when we walked. We had been separate in the store for a while, and when we came out, we were both walking towards our car, and we veered off from each other. As I was going towards the passenger side, he was going towards the driver's side, and I saw this car approaching me at a very fast pace. And when the car got right close to me, the woman had her window rolled down, and she yelled out her racial slur to me and told me she hated me and people like me. And, I was shocked. I receive racism every day in this city. And I know for a lot of people, that's very hard to understand, because many people I talk to say there is no racism in this city. And if you look like most people on this meeting today, it's true. You don't have racism in your life, so it's very hard to understand. But for people like me and Sarah, for her father, it's something we feel every day, and a lot of it is not quite as overt. It's when it's the look we get when we walk into a room that we are less than, that we do not belong. And for me, how that hurts. When we got back into the car that day, I was silent. I couldn't speak for a long time. And my husband said, Barbie said that she just didn't see you from across the way. But I was wearing my little orange pin, my orange t-shirt that day, which I have had on every day since the remains have been found in May, started being the finding of these remains. And he said, she had to have seen you in the store. And I remembered this as I was walking through Lowe's, and this woman, as I went down an aisleway, she was coming towards me. We're both wearing masks. There was no arrows to go one way or the other. But as I went to go by her, she pushed herself up against almost to the wall, and to not face me, to not be close to me. And I knew that it had been that woman that had yelled out at me, and she had to have waited outside, went out to her car and waited for me to come out to yell at me. And it's when I say it's a look that tells me I am not good enough, should not be here, what that feels like. But to have somebody yell out their hate at me, and I should be used to that, because I've lived with that my whole life too. And I did travel with the MMIWG, with Department of Justice, for over a year. And on the last, in Thunder Bay, I had a fall down a stairwell on December the 4th, our last week of hearings. And when the ambulance attendants came, they assumed, they said that I was drunk, and did not believe that I had had a fall, even though some nurses from the inquiry had seen me fall. The lawyers, two of the lawyers I was traveling with, had seen me fall. And these ambulance attendants, the paramedics, they did not check to see if I had a neck injury or any type of injury. They grabbed me under the arms and they pulled me up to my feet and said, "You're fine." They did not want to take me to the hospital. Those nurses, they insisted. They said, she takes a blood thinner, and she just fell down these stairs. She hit the back of her head, and she needs to get to a hospital in case she has a brain bleed. By that time, I had a softball size hematoma formed on the back of my head. And because those nurses and the lawyers insisted I was taken to the hospital, but the paramedics asked me what drugs I was on, and they said they could smell the alcohol from me. I haven't had a drink of alcohol in over 35 years. And one of the lawyers said, they could tell you weren't a street person. They shouldn't have treated you like that. And I said, but even if I was a street person, I deserve treatment like everybody else. These are not less than because they live on the street. They are less than because society has made them less than. And they should not be treated as less than when they are hurt. When I went to the hospital, the doctor, the first thing he said to me when he came in to see me was, "We don't give out drugs here." And he said, "So what is wrong with you?" And I told him about my fall. And he said, "You're not getting any drugs from us." I said, "Okay." I didn't ask for any drugs. I'm not a drug user. Never have been. But 11 times he told me I was not getting any drugs. Nobody ever cleaned my head wound. Nobody examined my head. I did have a scan, but I was not and everybody who came in to see me, whether they did a heart an EKG or and they double gloved to do this. They double gloved, of course, when they took blood. That I expected that, but to put these little tags on my body, they double gloved. They double gloved when they took my blood pressure. I have to say, the city of Ottawa, when I have been at the hospital many times, I have never been made to feel that I am less than. And but through our healthcare system. But I also know I lost a brother, and in part, I do believe it had to do with who he was alone at our civic hospital. And maybe how he looked, how he would have been dressed, and being by himself. So there is a lot of pain in this society, and I was married to I am married to a retired police officer. I've been 46 years with him. He was 32 years on the force. The last 8 years of his career, he was deputy police chief. And you have no idea how many events I would go to with him in this city. And I would come home and I would cry all the way home because of the racist remarks that were made to me at community events. And I'm so glad public health is doing this as part of this board today, because, when we stop the hate, we will improve the public health of all citizens in this city. And I am not less than. I don't want anybody to be treated as less than, and I want to see change in this city before. I have a little granddaughter, just a little bit. She's 2 years old, and I look at this baby and how precious she is. And I think of my little granddaughter, and I want her to be equal. I do not want her to walk into rooms and to be looked at as less than, and to be cared for when she goes into a healthcare situation, that she is not accused of being a drug addict or an alcoholic, and being told that they can smell the alcohol from me, and I was just trying to get drugs into my system. So I think that's all I am going to say. I don't know if anybody will have any questions for me, but or comments, but I will stay on for a bit.
Well, thank you very much for that presentation and that very personal approach to explaining the situation in our city. And I think the piece that resonated with me the most is, if we can get the hate out, then we're all going to be healthier. And I think that's good medicine. That's what really resonated for me. So we're going to go by list again in reverse order this time. You'll be happy to hear, Member Vanham. But I would invite anybody who has any questions or comments for either the Hills or Dr. Funnell to take this opportunity to ask either or both at that time. So first up, then we have Member Banham.
Thank you so much for your presentation. And I'll start off by saying that I hope that your granddaughter, and this is Aria, will be equal as well and will be treated the same, and will have exposure to each other and build relationships with each other, because I think that's important to ending the hate. And little Aria also liked your speech as well. I think it's important for them, even though they're very young, to hear these things. And I think what you're speaking about is so important. And sadly, in healthcare, we know that racism is ever present. We actually had Indigenous cultural safety training by a Melissa Hamill, who does research in Ottawa and has previously worked at Wabano. And she did research through her consultant firm regarding people's experiences, specifically Indigenous people's experiences with racism in healthcare. And it's really good research, and it really does demonstrate people's experiences with the healthcare system. So I'm so sorry to hear that you have personally experienced that, but I think it's important to share that story because it is indicative of a major flaw and hate in our healthcare system. So thank you for sharing that. I just wanted to say, you know, we have a universal healthcare system, but that should mean universal for all. And very clearly, it is not universal for all when people are experiencing what you have experienced, both with healthcare and in just trying to go about your day in that store. I'm very sorry that happened. And it does take education. I think part of creating a healthy society isn't just your body, your physical health, but also the health that people get to experience from being able to live openly as who they are in their society. So I really hope that through the work that you're doing, through the work that you shared that your husband is doing, and through the work that we're doing here, we will make this a healthier place to live. And that means both physically and emotionally. So thank you so much for your story.
Thank you very much. Member Kluche.
Thank you, Chair. Dr. Funnell, thank you very much for your presentation. Very informative, lots there. Barbara, thank you for your delegation, for your testimony, for the context that you give us that we need to hear and learn and internalize and relearn and amplify. We need to amplify the solutions, the what you've experienced so that you or your grandchildren don't experience it again. So I have no questions, but my deepest appreciation for taking the time to be here today. Thank you.
Thank you, sir. Vice Chair, please.
Yeah, thank you so much to both for your presentations. Barbara, your story is just so moving and motivating for all that we have to do. I guess my question, Sarah, is what more can the board do to provide support for the report, for the actions? Because I think it is it's just time to take action. And my question to you is, what can we do to support that and support the momentum and sharing the stories and building those relationships to move us forward?
Thank you for the question. Miigwech, that will be our Algonquin word of the afternoon, which means thank you. I think we could hear from our elder, Barbara Dumont Hill as well. I would say, we have a responsibility as a Board of Health, as leaders in our community, and some of you are elected leaders as well, to walk the talk. And so I'd encourage you, at the very least, at the very start, next week on September 30th, to make a commitment to reconciliation, however big or small. And don't underestimate all of us together. We can, with our collective action, we can move our community forward in terms of addressing systemic racism and get closer to reconciliation. That would be my suggestion. And if our elder is still here, yes, she is. Barbara, any other recommendations for the board?
The only thing I wanted to say is Dr. Etches said, that vaccines are our way of controlling COVID. And Murray St. Clair always says education is our way of getting out of the racism, the problem. And so I think becoming aware, teaching what you find out, listening, really truly listening when people are speaking, and that it stays with you and that you pass it forward.
Thank you, that's helpful, and your story will be something that I'm passing forward for sure.
Thank you very much. Member El Shantiri, please.
Thank you, Mr. Chair, and thank you, Dr. Fano, for your presentation. Really appreciate it. And to the Hill family, I don't know what can we say other than heartfelt thank you. I want to ask a question to our former deputy chief. Obviously, been away from the job for a number of years, and you were on the job for a number of years. Do you agree now more than ever we start to feel more against anti-Semitism, Islamophobia, indigenous people, gays, like we start to see a little bit more than before? Maybe before it was hidden, but now with the social media, and obviously since the election of Mr. Trump in the south of us seems it give a stage for this to be more. Do you agree now we've seen it more than we did before? I've been in the city for 46 years. I've been in politics for the last 20 years, and I've seen it has increased more as we speak.
I'm not an expert on any of this, but it seems to me that when you put human beings under stress, things creep out of them that normally they would keep hidden. And certainly that's the case now. People are under a lot of stress, and they're releasing that stress with their innermost feelings. So I think that our struggle against racism and systemic racism and discrimination is got to be an ongoing journey. We have to be ready to deal with it whenever it pops up, so it isn't allowed to fester and accumulate.
Thank you, David. And Barbara, maybe give you a chance to tell me how you feel about this. You've been in the city long enough, so.
For me, I see an increase in the last while. For sure. And so many people are so much very angry at, I know for on Indigenous people, they tell me that we are making them feel guilty. By wearing these orange shirts or these orange little t-shirts, and that we are speaking up about residential schools and all these remains that are being found across the country, and they are more angry at us. They would like us to be quiet, and so I think the hate is on the rise, and it's going to continue to be on the rise because of people like Sarah, and our son, and they're not going to be quiet. Our youth are not going to be quiet, and they're not going to allow this to continue. So I believe there's also hope and light at the end of the tunnel.
Well, thank you very much, Barb and Larry, for coming to join us tonight. Really appreciate it. Thank you, Sarah, as well.
And Mr. Chair, if I may respond.
Absolutely.
Evidence shows that healthcare providers and physicians, when they are overworked and burnt out, they resort to their biases. And that's not right. And so we have to have a system in place where people can complain, make complaints, and follow-up action is dealt with. So we need systems in place, such as our anti-racism, anti-oppression policies, where people can be held accountable to their actions, and that being burnt out isn't an excuse for this type of behavior. Miigwech.
Thank you.
Member Gower.
Thank you, Chair. Thank you, Barbara and Larry, for being here today. I appreciate it. And Dr. Funnell, thank you to you and your team at Ottawa Public Health for everything that you've put into this this program and this report. I just think what you are doing from that internal focus within the organization and how that translates into the external focus in the community is really remarkable. And I think a model that a lot of other organizations would be very wise to follow your lead on. And I guess that's my question. I'm curious about that. Is the framework, is the model, is the overall collection of reconciliation programs that you've created, is that something that you have been approached at all from other health organizations and public organizations in Ottawa? And do you even have the capacity right now, I guess, to assist? I'm just curious what kind of interest you've already received from other groups in our city.
So pre-pandemic, myself, Kimberly Trotter, and Aideen Reynolds, and other members of our team, we've engaged other partners provincially, nationally, locally on our plan. In fact, next week we are giving a talk at the University of Ottawa on the Reconciliation Plan, and I'm personally trying to promote it as a model at the federal level of revisioning what public health looks like for Indigenous people in Canada. So I think anecdotally, we're not aware of very many, if any, public health, local public health entities have a plan that has indicators and evaluation monitoring as ours does. Now, many include Indigenous health equity or anti-racism in their strategic plans or have plans for that. However, we know we can't tell that we're a culturally safe and humble organization unless we ask our Indigenous communities if we are. And so we've incorporated Indigenous ways of knowing into evaluating our work. And Dr. Etches and our team works tirelessly and prioritizes meetings with our Indigenous partners to speak with them and check in to see how we're doing in terms of our goals of being a culturally humble and safe organization.
Hey, thank you. I certainly feel like I learned a lot reading the report over the past few days and from the presentations today. And please continue to teach us, and it's very much appreciated. Thank you.
Thank you. Member Kavanaugh.
Thank you very much, Mr. Chair. I've always felt very, very privileged to have Barb and Larry as residents of Bay Ward. I'm quite honored. They're both outstanding members of the community who've done so much good work tirelessly. Even though Larry's been retired, he hasn't stopped. And Barbara, you've done so much work in terms of teaching and passing on your knowledge, which has been very important. I really appreciate it. So your story was even more shocking to me and made me feel ashamed and concerned of what happens in our communities. So I want to look at doing reconciliation and healing in the community. I'm looking at organizing something with the local Inuit Center to give people information about what happens there, because I think there's a lack of knowledge. These are communities that come down to us, and people know very, very little about it. But I'd like to do more than that. And Dr. Funnell, I really appreciate your guidance here too, because I do sessions with the community, and I think that would be helpful, just to have conversations and so clear up misunderstandings. And you just can't assume that people know things. Even though Ottawa is a highly educated population, they're not educated in everything. And I think that we need more. So I'd be thrilled and privileged if I can chat with you later about that, because I am working on one on Inuit culture, and I think it's important to have others. But this is the start. This is what we should be doing in our one by one to communities. So thank you to both of you for all your work, and Dr. Funnell, thank you for all your background work on this. It is so important. It's so vast, since it's so many nations and cultures. So I appreciate how much work there is to teach us and for us to learn. Thank you.
Mr. Chair, may I respond?
Absolutely.
I have to acknowledge our team on the report. So really, thanks to Kim Trotter, who's been working alongside Dr. Etches for over a decade in this area, and A.D. Reynolds and the rest of the team on supporting this report. And please do reach out. There's a plethora of resources out there on Indigenous culture, First Nations, Inuit, Métis, various programs and webinars. There's no end to it, so we can point you into a direction that you need. So, miigwech.
Cool.
You got ahead of me there. I was actually going to ask you that question. Dr. Funnell, if you could circulate a list of resources in advance of the 30th to board members that we could access, I guess I'm a big reader, so I guess this is a question for both you and Barbara. If you could each recommend one book to start with to get us on that path, what would that book be?
There's so many to choose from, but I would say one book that haunted me and has stayed with me for many years since I read it pre-pandemic was From the Ashes. It's about a Métis man who spent years on the street here in Ottawa, Toronto, and Vancouver, describes his experience. And he's now, I don't want to spoil the story. So it's a good read. I really enjoy it. What about you, Barbara? I'm always looking for recommendations as well.
I just finished reading Five Little Indians, and it really impacted me. the stories of their lives from beginning to end. And but like you say, there are so many books. I'm going to send Kimberly a list of some of my favorites after this meeting, and because there are so many good ones. I just also read The Break, and it was also a very moving, but of resilience. And a lot of people don't see it as resilience, but it is about resilience of our people.
This is one.
Thank you, Barbara. And as it happens, the Inconvenient Indian book show and tell. I have Indian in the cabinet over there on my list to read. It just so happens that Dr. Taylor and I are curating a list of resources to share with our physicians through our physicians update. So I'll just pull out that list and share it with the board. Miigwech.
Thank you to both of you. That would be great. And I think everybody on this meeting would appreciate receiving that. So thank you very much for that. Member Lakin.
Thanks, Chair. I wasn't not paying attention. I was looking into my bookshelf here to show you the book that I found compelling for us all to recommend, called Indian Horse, a very moving story that chronicles the life of a child removed from his family, placed in residential home, and found salvation and redemption in hockey. Something we could all learn from, whether it's hockey or otherwise. Thanks to Dr. Funnell and to the Hills. As a healthcare provider for over 30 years, every time I hear stories as I have this evening from the Hills, I continue to feel a horrible sense of shame that in healthcare we continue to fail to deliver care in a humane way. And while it's no exception, I feel it this evening when I hear this story. I'm also touched by a sense of hope that what you've done this evening is share your story with a number of people who are in turn going to take this and translate it into change. So thank you for helping at least me recommit to the process that needs to occur, and for sharing your stories with us tonight. Thank you.
Okay. I just want to say, Richard Wakame said when he wrote Indian Horse, he said, when you tell people about the book, tell them it's about hockey. Because if you tell them it's about the residential school, they won't read it. And he said, you have to tell them about hockey. And he said, if people knew as much about residential schools in this country as they know about hockey, we would all be better off. And so I think tell them it's about hockey.
Interesting suggestion. Thank you for that. Member Menard, please. Yes, there you are.
Thanks very much, Chair. My daughter and my son are just around here, so you hear them in the background. I apologize. I just wanted to say thank you to both of you. That Sarah, Dr. Funnell, that was a fantastic presentation, and I appreciate all the work you've been doing as well as of late, I guess, with Wabano and vaccination clinics and trust in community with immunization. And Barbara, I just wanted to thank you as well for all the work you've been doing in my ward, in particular with Carleton University. I know we've crossed paths in the past, and I love listening to you speak, and I just wanted to thank you for being here and sharing your story with us today. Thank you.
Thanks, Sean. Member Pinnell, please.
First, thanks, Dr. Funnell. And thank you, Barbara and Larry, for being here. Maintenant, Barbara, je voudrais dire un gros merci. Votre témoignage va droit au cœur. Puis un petit peu dans le sens que ce que Dr. Lakin, Member Lakin, disait, je pense que, parce que vous avez été ici, tous les membres, on va vouloir faire encore plus d'efforts. Puis en plus de ça, grâce à ça, ça va continuer avec santé publique. And because of that, I think that maybe we'll be able to build stronger community because of you. Thank you. Merci.
Merci.
And last but not least, Member Tilley, please.
Well, Dr. Funnell and Larry, good to see you again, Larry. And Barbara, thank you so much. Just tears at me to hear your experiences, Barbara, and just like so many, all of us have heard, whether in the news or firsthand from Indigenous and Inuit people, it's always so painful. And thank you for that reminder. I recently met with an Indigenous leader in the community, and he was telling me how centuries ago, the original maps that the British and the French started drawing up of North America had showed United States and Canada, or what would soon become those countries, as unsettled or uninhabited on those maps. That's how they referred to this territory, even though they were well aware there were Indigenous and Inuit peoples on these lands. They listed them as unsettled and uninhabited. So just so you know, the Ottawa mission, we're launching into our strategic planning session the end of this month, senior staff and board, and certainly Indigenous reconciliation with an action plan coming out of that is on our agenda as one of our key cornerstone initiatives as we look to how we can better serve the homeless population in Ottawa, and in particular the homeless Indigenous and Inuit populations in Ottawa, and Métis as well too. So thank you for this, and certainly I have a feeling whoever gets charged with that responsibility is going to be looking you up if you're available, Megwitch, and we'll hopefully do so.
Thank you, Peter. Seeing no further questions or comments, again, I want to thank all the presenters for a very informative session. And as I said earlier, a very personal session. So Barbara and Larry, for sharing your very personal story with us tonight. It's a huge thank you for that. Makes it all that much more real for us to learn from. So much appreciated. The board is being asked to, first of all, receive for information this update on Ottawa Public Health's reconciliation plan. And secondly, to approve proposed revisions and recommended priority actions relating to the reconciliation plan as outlined in this report and detailed in document number 1. So first of all, can we receive the report for information?
Receive.
Thank you. And can we approve, as I say, the proposed revisions that I outlined as well?
Carried.
Okay, thank you very much. Our next item on the agenda is item number 4, Ottawa Public Health's 2019-2022 Strategic Plan, Strategic Priority relating to mental health and substance use health. And we will have a presentation from Benjamin Lakin and Kira Mandrick, who will give a PowerPoint presentation. That will be followed by a number of public delegations. I think we have 10 today. So if I can ask members to save their questions for staff until after we hear from the delegations, and of course you'll have the opportunity to ask the delegations questions as well. So I'm going to turn it over to Ben and to Kira for their PowerPoint. Thank you for being here tonight.
Thank you. We're just waiting for presentation to come up. Okay, wonderful. Okay. Thank you. Good afternoon, everyone. My name is Benjamin Lakin, Program Manager of Mental Health and Substance Use, and with me is Kira Mandrick, Manager of Sexual Health and Harm Reduction. We are pleased to be with you today to present an update on Ottawa Public Health strategic priority relating to mental health and substance use health, as well as the recommendations in the Board of Health report to address the ongoing and emerging needs in the community. Before we start the presentation, I do want to acknowledge how challenging and distressing this past year has been on our community. The pandemic has truly intensified many issues, and in particular, the mental health and substance use health needs of our community. Next slide, please. Prior to the pandemic, we had seen concerns and issues related to mental health and substance use health of Ottawa residents, and unfortunately, many of these issues have worsened. Ottawans have faced and continue to face many hardships and challenges during this time. And while many people are demonstrating resiliency, tremendous resiliency, a great number of our population is experiencing worsened mental health and substance use health. Some examples of this, not an exhaustive list, but some examples of this across the lifespan include within infant and early childhood, we've seen negative impacts to movement behaviors. So this includes decreased physical activity, increased sedentary behavior and screen time, as well as increased food insecurity, negative educational outcomes, increased injuries at home, and increased reports of child maltreatment. Within children and youth, we've seen reports of worsened mental health, increased substance use. Since the onset of the pandemic, and an issue of significant and high concern that we're seeing across Canada, as well here locally in Ottawa, has been the sharp rise in eating disorders among children and youth. Within adults, similarly, we're seeing an increased report of worsened mental health, increase in gambling, increase in substance use. And again, of particular concern and significant concern, we've seen a 75% increase in suspected drug-related overdose deaths in 2020, and confirmed opioid overdose-related deaths have approximately doubled in 2020. Within older adults, many were isolated from their loved ones, and they experienced great losses of their peers. As well, caregivers faced added burdens and challenges throughout the pandemic, and that continues today. So we can see that across the lifespan, mental health and substance use needs have increased throughout the pandemic. Next slide, please. Improving the mental health, substance use health, and wellness of Ottawa residents is and continues to be central to Ottawa Public Health strategic priorities. As part of the COVID-19 response, Ottawa Public Health continued to work with school boards, hospitals, community health, workplaces, multicultural and racialized community partners, and the general community in delivery of mental health and substance use programs and services. We did this through two distinct yet interconnected strategies. The first is Ottawa Public Health's mental health strategy. This strategy is constantly evolving and adapting to meet the needs of the community. And through partnerships and collaborations, we continue to implement various initiatives with the goals of, firstly, increasing mental health literacy and stigma reduction. Two, fostering resilient communities, in large part through our work with many intermediaries. And three, supporting suicide prevention and life promotion efforts through training, awareness, surveillance, and research. The second interconnected strategy is the Ottawa Community Action Plan. This is a network-based strategy in partnership between many partners, including Ottawa Public Health, the Royal, the Community Addiction Peer Support Association, CHEO, Kids Come First Health Team, the Canadian Centre on Substance Use Addiction, the Ottawa Overdose Prevention and Response Task Force, and many more local and national partners. Ottawa Public Health is providing backbone support towards this work and the strategy, and our collective community objectives are to make tangible improvements in reducing harms from substance use across the lifespan through three key goals. The first is preventing stigma. Much of this work is being led by our community partners, the Community Addiction Peer Support Association, and they're helping lead and guide our work as well in this very important topic. The second goal is advancing harm reduction initiatives. So an example of this is our work that Ottawa Public Health has done with partners through the pandemic to integrate harm reduction services into COVID self-isolation and distancing centers and respite services, and increase availability of take-home naloxone kits for partnering community agencies that serve populations at high risk of overdose. The third overarching goal is collaborating and integrating across the system to centralize access to comprehensive mental health and substance use health services. And two really powerful and exciting examples of this include the development and implementation of the first ever regional coordinated access to mental health and addiction services for young adults and adults through our partners at the Royal and Regional Coordinated Access. This new service is called Access MHA, Access Mental Health and Addiction.ca, accessmha.ca. Very proud of this work. And in parallel, we've got a service for children developed by the Kids Come First Health Team called One Call, One Click. So this work is ongoing and very important and integral to our strategy overall. Next slide, please. So moving from the work that has been underway towards the work we will continue to do and expand upon, we're now going to go through the recommendations outlined in the report, which have been developed based on evidence, data, and identified need, which we've gathered through ongoing consultations and work with various community partners and individuals with lived and living experience. The recommendations are connected to the mental health strategy and to our Ottawa Community Action Plan, or as we call it, the OCAP strategy, and they seek to move forward approaches that will improve the mental health and substance use health of Ottawa residents with a focus on immediate priorities and supports, as well as policies that will improve well-being over time, including more action urgently to address the overdose crisis. To drive change and further action locally, Recommendation 1 puts forward OPH's action plan for 2021-2022 that we will undertake collaboratively with many partners to address these identified needs across the lifespan. The full list of initiatives can be found in the Board of Health report, and some examples of this work include providing the public health role of bringing knowledge to bear by developing a mental health and substance use dashboard that will inform Ottawa Public Health, community partners, and funders on the ongoing and emerging needs of the community to inform decision-making. As well, expanding on our work with the African, Caribbean, and Black community and the faith leader communities by increasing work and outreach with them on mental health literacy, stigma reduction, crisis response, strengthening these partnerships, and increasing access and availability of culturally appropriate services. As well, continuing to work with workplaces to create psychologically healthy and safe workplaces, including a focus on sectors that have demonstrated an increased need, such as the construction industry. Thank you. Next slide. Recommendation 2 is a request to adopt the guiding principles of a public health approach to substance use health. The current approach to substance use in Canada is not working. It's causing harm to people who use substances and to the broader community. Ottawa Public Health's proposed approach has been developed in partnership and collaboration with many partners, with those with lived and living experience, clinical partners, community health partners, many partners across the system. The approach builds upon the effectiveness of the established public health approach to mental health and provides a framework that addresses the issue of preventing health and social harms that can result from substance use through a population health approach. This aims to improve and protect the health and well-being of the community, as well as reduce inequities. There exists a growing body of evidence of the effectiveness of the approach from other countries across the world. Next slide, please. Recommendation 3 includes sharing this Board of Health report and the accompanying evidence with the Emergency and Protective Services Department within the City of Ottawa to help inform the Community Safety and Wellbeing Plan. Ottawa Public Health has and will continue to work in collaboration with the Community Safety Wellbeing team across the identified priorities of the plan, and in particular on the identified mental wellbeing priority. As part of this priority, OPH is working with many community partners such as the Ottawa Local Immigration Partnership, the Ottawa Black Mental Health Coalition, the Community Development Framework, the Ottawa Police Services, the City of Ottawa, and many more of these partners on something that has been developed and called the Guiding Council. This work is integral to the Community Safety Wellbeing Plan and as well to Ottawa Public Health. And the work is culminating to establish an enhanced mental health and addiction crisis response system that will improve the outcomes for those experiencing crisis related to mental health and substance use in the city. The work is progressing and ongoing, and Ottawa Public Health stays committed to this work. Thank you, and I'll pass over the next part of the presentation to my colleague, Kira.
Thanks, Ben. As we work towards recovery from the pandemic, all levels of government and funders of healthcare, local, regional, provincial, and federal, have a role to promote mental health and substance use health and address harms that can develop from substance use. The goal of these next 3 recommendations is to drive this system-level change. Our 4th recommendation includes sharing this report and the evidence found within with Ontario Health. As you heard earlier from Ben, we've seen significant impacts to the health of our community throughout the pandemic. Here we outline what our community partners and those with lived and living experience have expressed is needed to address the pressing mental health and substance use health needs here in Ottawa. Some examples of this include enhancing capacity to address eating disorders by increasing the availability of specialized treatment services in hospital and community settings. Also, increasing the capacity of emergency departments and inpatient units to identify and support those experiencing concerns with their substance use through the development of specialized addictions medicine teams and enhanced substance use services and supports. Increasing access to culturally appropriate mental health and substance use healthcare by improving the diversity of service providers and increasing access to cultural competency in anti-racism training for clinicians has also been identified as a priority. Lastly, increasing funding to support for the 24/7 mobile mental health crisis response initiative that Ben just spoke about that the Ottawa community is currently working towards. This includes Indigenous-led response for First Nations, Inuit, and Métis people in Ottawa, and an Indigenous-specific community treatment team. Next slide, please. Recommendation 5 involves bringing forth recommendations to the Provincial Minister of Health to address pressing needs within the Ottawa community. Ottawa Public Health is calling for the consideration of the inequities experienced by people in our society and the impacts that infant and early childhood development, poverty, and housing have on an individual's mental health and substance use health. We highlight the need for a health and all policies approach at the provincial level that would facilitate collaboration across many ministries and promote multiple sectors working together to impact the root cause of ill health and improve wellness. This approach is required because we know the drivers of health outcomes go far beyond the reach of the healthcare sector, including sectors like childcare, education, land use planning, industry, social service, and housing could truly result in significant improvements to Ontarians' health. Specific recommendations also include addressing the increased incidence of postpartum depression and challenges in child development by reviewing the Public Health Ontario report on the impacts of reduced home visiting programs. Integrating a health and all policies approach into the solutions for addressing Ottawa's and Ontario's housing and homelessness emergency to better meet the needs of residents. This would include not only expanding access and availability of safe and affordable housing, but also ensuring that individuals placed in these homes receive the wraparound health and social services that they need. OPH is recommending an evaluation on the impacts of the increased availability of alcohol using a comprehensive approach that looks at the social, financial, and health impacts. Alcohol is the most commonly used substance and creates significant harms to individuals, families, and communities. We have seen an increase in reported alcohol consumption during the pandemic. The availability of alcohol has also increased. And research demonstrates that as availability increases, so too does consumption and the risk of ill health effects. We are also calling for immediate further action to address the overdose crisis, which I will discuss in more detail next. Increasing access to health promotion and substance use prevention strategies, as well as overdose prevention and harm reduction services, is urgently needed to help address the overdose crisis. On this slide, you will see recommendations for provincial action from those with lived and living experience, as well as our community partners. They include advancing a system-level approach to addressing the drug overdose crisis across the continuum of services. This would increase the capacity of our local organizations to offer expanded and integrated substance use health, promotion, prevention, harm reduction, and treatment services. Increasing access to supervised consumption and treatment services, including removing the current cap on the number of Ministry of Health funded sites permitted in Ontario. Expanding and evaluating services that offer access to safer pharmaceutical alternatives to the toxic unregulated drug supply. Also, expanding the availability of drug checking services, including a range of service models and locations in diverse settings to meet local needs. Increasing availability of services for people using methamphetamine and other stimulants. This includes more training for service providers on supporting people who use stimulants. And lastly, increasing ongoing funding for grief and trauma support for people who use drugs, their family members, and workers who have been responding to the drug overdose crisis. Lastly, recommendation 6 involves bringing forward recommendations to the Federal Minister of Health to address priority health needs that have been exacerbated by the pandemic. Building on our provincial recommendations, this includes an expansion of the federal government's national housing strategy, including the integration of a stronger population health outcome measures to assess the strategy's impact and effectiveness on improving mental health and substance use health. We include an ask to limit alcohol marketing and promotion, especially to youth, by applying existing policies for tobacco and cannabis marketing as guides. This is an important impact that the federal government can have on reducing the harms caused by alcohol. We also call on the federal government to declare the drug overdose crisis a national public health emergency, and as such, develop a coordinated Canada-wide plan with not only input, but leadership from people with lived and living experience. This would involve enhancing federal support and funding for the immediate scale-up of prevention, harm reduction, and treatment services, including expansion of safer pharmaceutical alternatives to the unregulated toxic drug supply based on evaluation of initiatives that are currently underway. And finally, a recommendation to take action to advance alternatives to the criminalization of people who use controlled substances. We know that significant policy change is required to address and remove structural stigma, prioritize substance use health, and align with existing evidence. As Ben introduced earlier, the current approach to substance use in Canada is causing harm to people who use substances as well as the community, and is not turning the curve on deaths resulting from overdose. The impacts of resulting stigmatization alone have been devastating. While current dialogues are highlighting that broader policy reform is needed, the decriminalization of possession of drugs for personal use can have a positive impact on the lives of people who use substances and decrease the risk of overdose death from the unregulated drug supply. Again, the meaningful, equitable involvement of people who use drugs, along with other key stakeholders throughout all phases of drug policy reform, is essential to ensure that proposed or implemented changes have their intended outcomes. While this slide is not an exhaustive list, we want to take this opportunity to thank the many community partners that work in mental health, substance use health, and social services and protective services alongside with OPH. Your efforts have been tireless in helping our community, and it truly takes a community to improve, promote, and protect all of our health and wellness. As outlined in the report and in today's presentation, OPH is committed to this work and is dedicated to working together to improve the mental health and substance use health of Ottawa residents. Throughout the recommendations put forth and our key actions highlighted, we are focusing on immediate priorities and supports, as well as policies that will improve well-being over time, including more action to urgently address the overdose crisis. Thank you for your time.
Thank you both for a lot of work. That's a massive report, and lots of information to digest there. We're going to give you a bit of a break as we go to public delegations, but I'm sure that there will be questions from board members when we're done with that. So as I indicated, we have 10 delegations before us tonight. So thank you to everybody who's come out tonight. Your engagement on these issues is very much appreciated. And so first on our list is Supinderjeet Ratan, who is the organizer of Langar for Hunger. So I'll turn it over to you for 5 minutes, sir. Welcome.
Thank you very much, everyone. I hope everybody can able to hear me. Thank you. And thank you to Barb. I really thank you very much for sharing the story. It was very heart-touching. Hope one day will come and when we all see each other as a fellow Canadians, not by race or not by status. So thank you very much, Barb. Hello, everyone. My name is Supinderjeet Singh from U Foundation Langar for Hunger team. I see many familiar faces here. Thanks to everyone at OPH and everyone at the City of Ottawa for work they have been doing during pandemic since last year. The U Foundation was established in 2016 to bring communities together to empower people regardless of their race, religion, status, background. The motto of U Foundation is service to others is key to improving our own mental health while building a caring community. We strongly believe and promote the act of doing seva, selfless service, improves our own mental health. The U Foundation initiative includes 3 programs: Langar for Hunger. So we serve food at the shelter and help in community outreach and help in wherever there is a natural disaster or significant issues have arisen. Our team helps and serve. Socks Box is the second one. We collect and donate socks to various shelters. Peter Kelly is here. He knows very well. Achint Universe, which is mental health. Achint Universe is a Punjabi word that means a state of stress-free mind. A stress-free mind leads to a healthy body. Healthy body can then build healthy communities. We promote a better understanding of mental health by organizing free seminars, trainings, events, and workshops. Places of workshops are always very special for our community. People come to pray, eat, socialize, heal, and connect over the years. Over the years, we have noticed that some members of our community were struggling with their mental health, even though we all experiencing challenges. Talking about mental health and suicide is a cultural taboo for most families. A few years ago, we reached out to Ottawa Public Health, who provided safe talk suicide prevention training for leaders in our community. Ottawa Public Health also provided an information session at our Gurdwara Sahib place of worship on mental health. Our faith and community leaders plays an important part in helping people who are struggling with mental health. Most recently in 2021, we reached out to mental health team at Ottawa Public Health to provide information to our faith leader involved with Agent Universe team, and moreover to all South Asian faith leaders. OPH understands that many communities look to their faith leaders for guidance on a variety of social and health issues. This was evident on the findings of the 2020 Mental Health Ottawa Black Community Research Report study, in which faith-based centers were the third most frequented settings for the mental health support, and our community is similar. This is further evidence that increasing mental health information training to faith-based centers is crucial in creating strong mental health awareness in the community, as well as preventing harm and connecting people to help they need. We are grateful for the 90-minute faith leader workshop, which included concepts such as mental health and mental health illness, mental health stigma, crisis support, suicide prevention, self-care among faith leaders, and mental health resources. Additionally, OPH provided learning opportunities such as fully subsidized spot and living work starts, suicide prevention training module to all our community leaders. These type of training provides our faith leaders with the knowledge and skills to recognize when someone is having a difficult time, and when and how to connect them to help. It lets our faith leaders know that they themselves also need to take care of themselves by knowing their mental health as well. Feedback from this training workshop has been extremely positive, and some faith leaders have noticed that they have become more emotional towards because of how important they believe this topic to be. Ongoing support for programs such as these can be life-saving. On behalf of Agent Universe Hunger for Hunger team, we would like to express our continuous support for the Ottawa Public Health is involved in with faith leaders. We are very much interested in working together on future faith leaders program to continue providing these important and much needed informational session to our community. Like many communities, speaking to mental health professional might not be easily accessible or culturally appropriate. In that case, speaking to faith leaders from a similar culture and racial background is often more preferred. Thank you for this opportunity, giving us the opportunity to share this with everyone. Thank you very much.
Well, thank you for coming out tonight to share with us. Are there any questions for this delegation? Seeing none, thank you very much. And we will move to our next delegation, which is Michelle James, who is a coordinator for the Ottawa Black Mental Health Coalition. Good evening, Michelle. Welcome. You have 5 minutes.
Thank you so much. Good afternoon, everyone. My name is Michelle James, and I am the coordinator of the Ottawa Black Mental Health Coalition. Our group is comprised of over 20 Black leaders and collaborating partners in mental health, healthcare, social services, and community development. I'm very happy to be here this afternoon to highlight the partnership of member organization Ottawa Public Health and the dedicated individuals on the team that bring the collaboration to life. The Ottawa Public Health mental health team has been instrumental in advancing the collection of disaggregated data specific to the Ottawa region. The report on mental health of Ottawa's Black community, released in 2020, is an important first step. This work has supported the coalition in providing evidence to guide the coalition and its member organizations to better serve the needs in our communities. It has also become a resource for stakeholders and partners in the mental health sector here in Ottawa. The barriers and facilitators to access that are highlighted in the report are reflective of the feedback that we've seen in the community. This report has been a valuable starting place for closer examination of the systemic issues that impact service delivery and impact health outcomes. As the diverse population of Ottawa continues to grow, so too does the approach of Ottawa Public Health. The African, Caribbean, and Black community alone is so diverse. ACB communities reflect a myriad of languages, cultures, religions, and lived experience. By recognizing the unique challenges faced by the ACB populations in Ottawa, OPH has actively looked for innovative ways to connect with this often hard to reach group, and all while addressing barriers and stigma. Through collaborations like the ACB Mental Health Supports Environmental Scan, the ACB Vaccine Initiative, Black Mental Health Week, and the Coalition's priority working groups, OPH's team continues to demonstrate investment in outreach and in outcomes in the ACB community. Recognizing the role of faith leaders and organizations and the roles that they play in fostering social connection and mental well-being for our community, OPH has made efforts to engage and provide resources where they are needed, when they are needed, and where communities gather. Additionally, OPH has collaborated in engaging the existing resources that are readily available already in the community. This includes international health professionals who are familiar with the ACB community and have the capacity in a variety of languages to support. Also key is securing culturally appropriate Afrocentric venues in the community in order to deliver services. As the Ottawa Black Mental Health Coalition moves ahead, we will continue to look for alignment with Ottawa Public Health and to maximize our partnership. While we have made gains recently, raising awareness, increasing access to services, and working to reduce stigma and strengthen the dialogue, I think I don't have to say that there's still a lot of work left to be done. The supports that are needed, the trust that is being nurtured, and the solutions that are still yet to be found cannot be temporary. This investment in the community must continue if the long-term goals of improved mental health outcomes for ACB residents is to be achieved. It is important that the Black community in Ottawa, and indeed all communities in Ottawa, continue to see growth and investment in their well-being. The Ottawa Black Mental Health Coalition looks forward to continued collaboration with Ottawa Public Health, the City of Ottawa, and all of our members and stakeholders who are working to ensure health equity for our families, our communities, and ourselves. Thank you very much for this opportunity to highlight this vital work and to demonstrate how important it is to the coalition and to the community that it continues. Miigwech, merci beaucoup, and thank you very much for your time.
Thank you very much, Michelle. I have a quick question for you. I think I may be paraphrasing you a little bit, but you said it's important that these steps are not temporary, I think was the term that you used. What do you see as the single most important step going forward for your community vis-a-vis mental health issues within the city? What if you could have one wish, what do you think is the thing that we should be pushing forward as a board and as an organization with regard to your community?
I think that I would love to see more place-based supports. We see a lot of correlation between people's accessibility and walkability to resources in their community, and the correlation with anxiety and depression. We know that people feel more comfortable. We talk about these facilitators to access, like, being able to speak with someone who is reflective of you in your community, for example, having greater representation, not just at the front line level, because again, I don't think that the solution is to stick a bunch of frontline workers, ACB frontline counselors, into a racist system. We need to look at the system itself and make sure that we're not only supporting the individuals in the community that need the help, but also the counselors, the faith leaders, and those people that in the community, in the grassroots organizations that are sort of really there in the front line and working with people that already have the established trust and relationship with folks that's needed to have some of these very difficult conversations. I think too that it's important to recognize, it's not enough to just have someone who's Black. There, like I mentioned, so much diversity within that community, within language and culture, and experience, especially. My experience as a Black North American woman is going to be very different from what a newcomer might experience. So it's really important to look at that diversity, acknowledge that diversity, and put the supports where people already are.
thank you for that. And I saw on my screen, I don't know if everyone can see if Ben's taking notes. So thank you for that feedback. Are there any other questions for this delegation? Thank you again for coming up, Michelle. Much appreciated for the support. And next on our list is Gord Gardner, who's Vice President, Community Addiction Peer Support Association, CAPSA. Gord, oh, there you are, Gord. Over to you for 5 minutes.
Okay, challenging. So here we go. I'm in Vancouver, working on substance use health, discrimination, and racism with the University of British Columbia, Equip Health BC, which works on equity for all people, and we're working on toolkits to roll it across the country on healthcare systems and how to examine them around those issues. And I say that even though I'm here to talk about Ottawa Public Health, because without Ottawa Public Health, I wouldn't be here in Vancouver. And so our partnership with Ottawa Public Health has been a model that I've been able to take out across the country and show other people what meaningful partnership and engagement looks like, what respectful learning looks like, what it's like when people say, actually, yes, we have knowledge and we have information, but we don't have your lived expertise, and to see that as a partnership as an education piece. Ottawa Public Health, the nursing department, community nursing department is one of the first organizations who agreed to let us educate them in a formal setting. And to sit and then to reaffirm not only had they learned, but they had learned how to take that information and share it in the organization itself. We got a little stop on that when the pandemic hit, and we all understand that. That would make sense. It was a pandemic. But that, okay, that's a powerful moment for CAPS as an organization, a powerful moment for Ottawa Public Health. I was listening to some of the earlier testimonies and I heard the same sort of thing. Ottawa Public Health is an organization that can learn from its community how to serve its community. So I'm able to take that information now and share it across the country, what that looks like. So just to hit on a couple of those highlights. So we've been involved with the Ottawa Community Action Plan from the get-go, facilitating community dialogue, bringing people with different lived experiences forward into meetings to get feedback that way. So that's what happened to me at the hospital, or how come I couldn't get to the hospital, or how come the doctor wouldn't talk to me. And then there's this other level of organization when we talk about what the hospital should look like, what the doctor's office should look like. And so often you see in other organizations where we're asked to talk about our experience as if that's the only thing we know in the world. So we get asked what it was like at the restaurant, but we never get asked what kind of restaurant there should be. And so Ottawa Public Health has done a really good job of asking that bigger question. How do you see the system? How do you see the service level? And not restricting us to that moment of healthcare, right? So another way to express that is we're not labeled and confined to a health experience or had. We're seen as skillful, knowledgeable, and talented and in partnership. So that's really helped shape a lot of different things. It's really helped shape the summit in many ways. It's helped shape the language in many ways. Publicly facing the reduced stigma. And of course, you know, Ottawa Public Health has been a big member of Recovery Day these last few years. They were there on Friday again, using the language of the future of substance use health. And there, as we announced that from now on, we're going to be having the WOW Festival here in town, working on wellness, physical health, mental health, and substance use health standing beside each other. We believe that that is also something we're going to template in Ottawa and roll it across the nation. I've got people in several cities interested already. But I want to go back to that point where I have this touchstone that I can sort of put my hand on and raise up and sort of show people and say, yeah, that's what we're doing here. You just met with Donald McPherson, who just helped host the Canadian Drug Policy Coalition Getting to Tomorrow in Ottawa, you know. And in Vancouver, they don't have that kind of relationship we do in Ottawa. And so I met with Donald for about an hour yesterday. And again, he was going, wow, Ottawa's different, eh? Yes, Ottawa is different, and that's Ottawa Public Health that's making that difference. I'm not sure if everybody knows me that well, but there's sometimes I don't say that nice things about people because they're hurting others. And so I want you to know that I'm not making this up, that I'm being very sincere about this, and that it really does matter, not just here in Ottawa, but it matters in the country. And so I see that as leadership. I see that leadership at the board. I see that as a city situation that's changing. Going forward, I know we're going to do more first language training within the system, that Ottawa Public Health is going to support that, and we're going to support Ottawa Public Health around that. We're focused on, we just come up with a 2-year strategic plan around substance use health and mental health. That's game changing. And I think if I go on anymore, people will begin to wonder about my sincerity. If you don't have too much butter in your ear, you can still hear me. So I also want to note that I had an opportunity to present to the board directly on an issue that's very dear and important to me. And that decision by the board to allow me to present is notable. Right. And the feedback I got that from their various people, including yourself, Keith, was that it was good to have done that. And I look forward to doing more work together. I want to thank you for being open-minded. We have a difficult job sometimes bringing information to people about how things aren't working so that we can make them work. And so I really appreciate that seeking to understand, right? It was just with an Indigenous elder who went to a hospital here in Vancouver, and she'd been working with people and seeing them into the next life for a number of years. And it was the first time she'd ever been treated respectfully. In all those years at the emergency department. And so, you know, and we were all going, isn't it wonderful the work we've done? And then we all kind of had a little boohoo and realized it shouldn't be wonderful that someone's treated respectfully. That's just how it's supposed to be. So I think about some of the other people presenting today, and I think that they're not asking for anything wonderful, eh? They're asking for what should be commonplace, respect and dignity. And so I'll say goodbye on that note. Thanks for your time. And I'll say bye.
Thank you very much, Gord. That was an excellent note to leave us with, I think. Anybody have any questions for Gord? No questions for you tonight, Gord, but again, thank you so much for coming out and supporting. Much appreciated.
Good to see you all. Thanks a lot.
Our next presenter is Dr. Kim, I hope I say this right, Karas. Oh, that's close. Vice President at the Royal Ottawa Hospital.
Thank you. It seems I can't start my video just because the host has stopped it, so sorry about that.
Well, we can hear you just fine.
Okay, perfect. Oh, there we go. Excellent. Thank you all, and it's a pleasure to be here today. And I'm really delighted to have the opportunity to speak about a couple of things that are actually really important, not only to the work that I do here, but to the system. And that's our partnership with Ottawa Public Health in many ways through the work of the Royal, and also through some of our work at the system level, particularly regarding the OCAP that Ben spoke about, I believe, maybe 15 minutes or so ago, related to the Ottawa Community Action Plan and its goals, specifically about improving access to the mental health and addiction system. So that's what I'm going to talk about today. So in terms of the close collaboration and partnership with OPH, there's numerous initiatives that we partner with that we're with the Royal and OPH, including co-chairing the Suicide Prevention Ottawa Network together. And of course, there's other partners involved with that, many who may be here in the, who are joining us remotely today. Ottawa Public Health has stood up, and for many years, Kira, I'm trying to remember how long ago, but at least 4 or 5 years, the Overdose Prevention Task Force, and been pleased to be a partner in that work across that system. Gord talked about this just now. Sorry, I work closely with Gord, and that's developing and leading many public-facing events, knowledge translation events, town halls together on mental health, workplace health, suicide prevention, stigma reduction, and the importance of that work. And then, of course, as I mentioned, advancing the work together as a steering committee members of the Ottawa Community Action Plan. There's lots more, but in 5 minutes, I just want to focus on the pieces of the OCAP plan. So as Ben mentioned, goal 3 was collaborating and integrating across the system to centralize access to mental health and substance use services. And connected to this work has been the development and launch of regional coordinated access for mental health and substance use services within our region called Access MHA. OPH has been a partner with this from the beginning, along with 40 plus agencies, primary care providers, people with lived expertise, and social service providers. Many folks and system stakeholders to get that off the ground. And that's really in response, and sorry, Ben, if you've already said this, and if so, you can cut me off. We have a really complex, confusing system for people to get access to. And what we've been hearing for years and years is, how come it's so hard to even know where the first point of help is? How come when I'm struggling, I don't know where to go? And that has been huge pressure from our person with lived expertise, our community members, primary care providers saying, it shouldn't be this complex. It shouldn't be that challenging. When people are looking for a service, they should just know a place to go. And really that was the impetus, again, not just for that OCAP goal, but also for Access MHA. And we've been doing this work for about 3 years. Access MHA just launched in March, and it's a single point of access for those looking for mental health, substance use, or addiction services. And as I mentioned, it has 40 some odd partner agencies, OPH being one of them, throughout the region, including One Call, One Click. And if you looking at the report, there's specific mention of them. And that's the coordinated access for the child and youth system, really so that we can ensure that together with all of our agencies, with our partners, with our system stakeholders, we are making it easy as 1, 2, 3 for people to get access to the services they need and they deserve in a compassionate way. When we don't have easy access to services, it is very stigmatizing for other folks. In no other healthcare condition is it okay for people not to go where, for people not to know where to go for help. And we need to ensure that for mental health, substance use, and addiction needs, that people know where to go for this. Integrated into this is peer support, which is really important part of the work that we do. And, designing and implementing initiatives using the best practices, ensuring that people with lived expertise are part of all phases of the work that we do, including driving, delivering, implementing, and refining and evaluating the work. The persons with lived expertise sit at the decision-making tables of how we deliver the Access MHA services. So really needing their expertise and experience as partners in the co-design and adopting a real evidence-based approach to continuously learn and improve. We have a whole evaluation and research piece built into Access MHA. And because of that, we've been able to capture emerging population health needs and trends and enable, finally, system-level data for what are the needs of the population we're trying to serve. We've served nearly 3,000 individuals since we first launched in March. And because of that work, we've been able to identify that the #1 reason people are seeking services through Access MHA is actually for substance use concerns. And I think that's really, really telling in terms of what our community needs and our response. So in sum, through this work we're doing together, we're hoping not only just to improve access to the system, a better journey for people looking for services, better integration across the system, across social services, health services, primary care services, so that it's connected and it's coordinated and people know where to go. And of course, having that important data to help drive the decisions that we make so that we're responding in accordance to what people need and, frankly, what they deserve. Thank you.
Thank you very much, Doctor. Much appreciated. I don't know, are there any questions for the delegation? I don't.
Generous Lewis, I do have a question.
Okay.
To make sure that I take away the message correctly. So if I could pose it, that'd be helpful. Yeah.
Are you looking to me? I'm happy to answer a question. I didn't know who you were asking.
Well, I was asking the chair if I could ask, and
Oh, absolutely. This is the time to ask delegations questions. Absolutely.
Great. So thank you so much, Dr. Corus, for the presentation. On the board, we know that OPH is upstream. We're not really in the business of delivering mental health treatments, but I want to make sure I understand your takeaway that as public health, as someone involved in public health, we can actually influence mental health outcomes if we try to influence the system, if we partner effectively, and we rely on data and evaluation to guide our decisions. Did I get the takeaways?
Absolutely. And it's that multi-sectoral response, Dr. Lakin, that's really, really important in terms of across the system. And of course, making sure that what we do not only is data-driven and evidence-based, but also really incorporates the lived expertise of folks who are wanting to access that.
Awesome. Thank you for clarifying, and thanks for presenting.
Thanks for having me here. I really appreciate it.
And I think Peter Tilley member Tilley has a question. I'm just going to ask board members, if you do have questions for the delegations, if you could just use the raise your hand feature on the bottom of the screen. I know Peter waved his hand and I did catch it at first, but if you use the raise your hand, it's just easier to keep track of. But over to you, member Tilley.
Dr. Corus, thank you so much. Very great to hear this Access MHA service. You'd mentioned that since March, 3,000 individuals, and you said the number one issue has been substance use. Do you think that would still be the same without a pandemic? If you were running this service, in other words, what impact do you think the pandemic has had on substance use to be the number one mental health issue or number one issue that people are seeking advice on or assistance with?
So thanks, Peter. I can maybe give you a bit of some contextual background and how that would inform this. I can't answer specifically why now for this specific individual, but I can speak to some of those contextual issues. One, we know that, and you've heard this through and seen this in the report, opioid use rates and concerns have really increased during COVID with increase in. Two, we know that alcohol consumption has increased secondarily to COVID. Three, we know that systems and services changed the way they provided services at the beginning of COVID. Of course, things have now shifted over time. We're in, with the phase and wave we're in now, but where people didn't know to go for help. So you had this real perfect storm, for lack of a better word, where you have increasing rates and unclarity and not sure where to go and changing system. So that puts together how that potentiates that. And I think that speaks also to issues related to prevention, issues related to folks who may not have previously had a substance use concern, and how both COVID and the changes on how services were offered, especially in the substance use field. If you look at services, they specifically changed for how we offered substance use services provincially because of COVID and because of just some of those treatment modalities. So I think together that probably has increased that. Fourth thing, in our experience as well, people are more likely to self-refer for services for substance use than they are to get referred from a provider. And I think that really speaks to maybe people's openness and willingness to discuss this with other providers and really wanting to seek services on their own for many reasons, not least of which is stigma. I don't know if that helps you, Peter.
Yeah, thank you. Very well summarized. The imperfect storm. Absolutely. Thank you.
Very much. I don't see any other raised hands. So again, thank you, Doctor, for coming out. Much appreciated.
Thank you so much for having me.
And now turn it over to Wendy Muckle, who's no stranger to this board or many other committees in the city. from Ottawa Inner City Health. I don't think I need to tell you, Wendy, the usual rules about 5 minutes and what have you, so I'll just turn it over to you.
Thank you very much, Chair Egley. So thank you for the opportunity to speak to this. I think we can all agree it's a weighty report with some very significant recommendations. I'm speaking in support of the report, and I would urge you to support the recommendations as presented. Ottawa Inner City Health has been on the front lines of mental health care, substance use treatment, and harm reduction, working shoulder to shoulder with public health long before, but also all throughout the pandemic. I'm not going to tell you what a wonderful partner Ottawa Public Health is because many others have done it, but I will just say that ours is a very long-term and sustained relationship which has brought great benefit to our community, and Ottawa Public Health are wonderful partners. I do want to talk about why this report is so important and why you as the Board of Health need to throw your report, not just as board members, but also as organizations and individuals in our community behind it. The impact on the mental health of our entire community through COVID has been cause for concern. But for people experiencing homelessness and for people who use drugs, they have been forced to bear the harms to their health disproportionately. And the negative impacts on their well-being are being felt across our entire city as their suffering is experienced as social disorder, drug overdoses, and the rising rates of problematic substance use, which are affecting our entire community, as we heard in the previous presentation. Through the last 18 months, our world has changed, and there has probably never been a time when a population health approach to mental health and substance use was more critical to the future health status of our community. These recommendations are a call for bold action, which I hope you will heed and that you will support. Our old ways of addressing mental health needs, our old ways of treating substance use disorder are simply not going to be enough to restore this community to the pre-COVID state, and they are certainly not going to be enough to move the needle forward by providing equitable access to populations who were marginalized and discriminated against in terms of access and benefit from those services previously. This report also tackles some of the opportunities for positive action, which will take us outside of our local community. And as our leaders, as the Board of Health, we urgently need you to demand change and to add your voice to the growing calls for action on decriminalization and access to safe pharmaceuticals. Throughout this pandemic, Ottawa Public Health has done an excellent job of reminding people about the importance of taking care of their mental health. This leadership has had an immediate and an obvious impact on stigma, and it has really normalized the conversations around mental illness and made it not just acceptable, but also a positive thing to seek support around your own mental health concerns. But it's now time for you to broaden this conversation by talking about substance use in our community. I know we're all concerned that the public health measures, which were an essential part of our COVID response, have had the unfortunate and unintended effect of disconnecting people from relationships and experiences which were essential to their well-being. For some, these connections with people, places, and community have been replaced by relationships with harmful substances. And for people who access these substances through the illicit market, the instability of the drug supply, the adulteration of available products, the experience of stigma, and the marginalization by the community have accelerated the harms. For people who use illicit substances, harm plays out in terms of the harms of overdoses, the rising rates of crimes of acquisition, and a growing sense of alienation from the rest of the community, resulting in a loss of motivation or hope for a better future. Stigma is killing our people. For our larger communities, harm plays out in terms of rising rates of social disorder, deteriorating senses of community safety and security, and the dehumanization of people who use drugs. These are serious problems. It's a serious situation, and it's not going to be resolved without leadership from bodies like the Board of Health, lending their voice, their energy, and their vision to preventing further harms in our community and supporting positive change. So I urge you to accept this report and to throw all of your energies behind implementing the recommendations. Thanks.
Thank you very much, Wendy. Your support is very much appreciated by the board. And I'm sure the staff too that put in all the time on this report. I don't see any hands raised, either virtual or otherwise. So I don't believe there are any questions. But once again, thank you for your engagement and your support. Much appreciated.
Thank you so much.
Our next speaker, I'm informed by Diane, Sean LeBlanc, it can't be with us any longer. So we're going to move to the next speaker then, which is Rob Boyd from Sandy Hill Community Health Center.
Okay, good evening, and thanks for giving me the opportunity to speak to this. And like Wendy, I also want to, on behalf of Sandy Hill Community Health Center, endorse this report, and encourage that the Board of Health pass it in all of its entirety, because it all really kind of works together in terms of what needs to happen. And I want to commend Dr. Etches and the team at Ottawa Public Health for an excellent report, very comprehensive, very thorough, and definitely on the right track of what has to happen. You know, those of us living and working on the front lines of this dual public health epidemic have often been overwhelmed in the last 18 months with the volume of work, the urgency of need, the mental health decompensation, and the increase in the number of overdoses and interventions, and the tremendous losses that the community has been experiencing as a result of all of this. In fact, I think Sean would be okay with me sharing that that's part of the reason he's not attending tonight, is that there's a situation that's come up for him where he's supporting somebody who's had an overdose. We've lost a lot of leaders in this community as well, people who have really stepped up and have been part of some of the advocacy efforts, and we need to nurture the leadership that we have, and we need to build new leadership. And I want to make sure that as we're going forward and we're talking about meaningful involvement of people who use drugs, that this also includes an adequate compensation framework and a recognition of the needs that they have and the special risks and challenges they have about trying to be advocates within their own community, which is being devastated by the opioid toxicity crisis. We used to talk about fentanyl and fentanyl analogs tainting the drug supply. Today, they are the drug supply that we have in the unregulated market. And this has been a huge shift and a huge change. It really changes everything. With this being the normal of what people have access to, that means that we're seeing an increase in the number of daily injections that people are requiring just to not get dope sick. We see an increase in the number of overdoses, both fatal and non-fatal, with the non-fatal ones risking an increase in acquired brain injury as a result of that, which is going to significantly impair people's daily functioning, their ability to recover, and their ability to reintegrate. We see a decrease in retention and care for opioid agonist treatment, as we're not able to match the doses that are happening out in the community due to fentanyl and fentanyl analogs. And we're seeing a diminishing capacity on the part of people who use drugs to engage in hopes, dreams, and goals that they have as they're caught up in this rapid, intense cycle of substance use. Services that we've put in place, like supervised consumption services, are and take-home naloxone, are overwhelmed by demand and by a seeming increase in the number of people buying opioids in the unregulated market, and people wanting to access services in order to keep themselves alive. We also have unregulated drugs, benzo drugs in the drug supply as well, which our sites are not set up to monitor people for those periods of times of the benzo overdose. Nobody saw this coming, and our services are not designed to address the supply that we have today. The decriminalization of drugs for personal use is an obvious first step, as is the decriminalization of drug selling for an individual who's living in poverty and dependent on the opioids themselves. It's important as we start thinking about moving forward decriminalization that we are not criminalizing people who are subsistently dealing the drugs, and to really focus on some of the violence and other crimes associated with the drug market, and those who are making for-profit drug sales. As the report says, criminalization is a driver of stigma, and as has been talked about already, stigma is a barrier for people accessing care. Recently, I think you were all invited, and we had the Getting to Tomorrow drug policy dialogues, and there was, really a universal acceptance and agreement that the prohibitionist drug policies that we have in place are not only not working, they're actually creating harm for people, and that we need to start moving towards a public health approach to drugs. And this is endorsed not just by healthcare, not just by public health, not just by community health, but also by the Canadian Association of Chiefs of Police and Ottawa Police Services as well. decriminalization itself is not enough. We also have to invest in the things that this report talks about. It really is about investment in treatment, housing, substance use response teams within hospitals, and opportunities for meaningful work and training, as well as access to safer alternatives to the unregulated supply. If we want to compete with the unregulated market, we have to provide access to drugs for people in the way and in the concentrations that it is that they're looking for. So we're now dipping our toe in Ottawa and the safer supply, but we need more access and we need stronger drugs. And we also need access to injectable opioid agonist treatment that's referred to in this. The barrier to that is that it is not on the provincial formulary, so we don't actually have the access to the medications that we need to prescribe to people. We need access to drug checking services at CTSs and festivals throughout Ottawa, and so that people can make informed choices prior to their consumption of the drugs that they're purchasing. So this Getting to Tomorrow created an opportunity and an energy within this community where people who have been going through these tough times of the last 18 months and really longer for all of us with the opioid crisis, where there is a renewed sense of hope. And I really hope that you as the Board of Health will help make that hope more tangible through supporting Ottawa Public Health and their leadership on the substance use and health in Ottawa. So thank you very much.
Thank you very much, Rob. And I agree with you wholeheartedly. The Getting to Tomorrow dialogue for 2 days last week was just an amazing experience. The mixture of different types of expertise and experience was just like a very well mixed recipe. It just all came together for some very fruitful discussion. So thank you so much for your support for the report and the work that staff has done, and your advice to us to support that work. I don't see any hands up, so we'll move to the next delegation then. But again, thank you so much, Robin, and thank you for explaining why Sean couldn't be with us tonight, because I know it's an important issue for him as well. So thank you for that explanation.
Thank you very much.
Next up, we have Aaron Ross, who will be joining us.
Chair Aaron Ross is not on the call, so we're going to move to Doug Hunter.
Oh, I'm sorry. So Doug Hunter, then, who I can see is already on the screen. Good evening, Doug. And Doug is here for Families for Addiction Recovery.
That's right. Thank you. Yes, and thanks for giving me the opportunity to speak today. I'm going to be a bit briefer than I planned because so much of what I was going to say has been covered already. So because I appreciate how much time and energy all you folks are putting into this issue, so I'm going to try and be briefer than I might have. My name's Doug Hunter. I live in Ottawa. I'm a parent of an adult child who has a substance use disorder as well as some mental health challenges. I'm a member of a national organization called Families for Addiction Recovery that is involved with families across Canada. This organization provides free of charge peer-to-peer support for parents with children who struggle with substance use disorder. I'm both a peer supporter for other parents and also chair of the education committee for this organization. And this committee is working to improve the level of education of professional organizations across the country, such as doctors, psychologists, and nurses. We're also advocating on several fronts to improve services and change drug policies to support better health for our loved ones. So I want to start by saying, first of all, I'm just blown away by the work that Benjamin and Kira and the OPH team has done. In reading the recommendations and the initiatives that have come out of their work, it's very comprehensive in what they're saying. I really am asking as representing families and parents to asking that the Ottawa the board approve what these initiatives are saying. There's a few points I'm going to touch on in them that I think are wonderful in terms of the comprehensiveness that you looked at this. I'll speak to the treatment facilities. First of all, the importance of getting treatment facilities. My daughter is currently being told it's going to be months before she can get into residential treatment. And so it's just tragic trying to maintain her. And I personally thank Rob Boyd, Gord Garney, Wendy Muckle, Kim Carace, all who I personally know for being assistants in keeping my daughter alive through this period of time. It's phenomenal what is being done so far, but the potential for even more to be done is tremendous. So I really appreciate the work that's been done. We represent parents across the country. As I said, we're a national organization. So we see from a parent's point of view. I am integrated within the Ottawa community as well, but we are national. So I'm not as active on a day-to-day basis in Ottawa, other than providing peer support to parents. So the couple of points that I just want to mention. First of all, it was all the harm reduction initiatives, safe supply, the decriminalization. I fully support. And I think the point that Rob made on decriminalization as well is a very good one, that you can't just be personal for personal use. The majority, from my knowledge and experiences, a lot of these youth are selling drugs as well to support their habits. So we have to be sensitive to that. It's the people that are actually making profit from it, and the people that are part of gangs and so on that are doing this, we need to be targeting. It's not people that are selling for to support their own addiction. That's one factor I wanted to make. The pieces that was talked about alcohol, fabulous. We need to be doing something that stops promoting alcohol as being this wonderful social thing that's going to enable a wonderful life. And we need to be putting labels on this. We need to be stopping the marketing and selling that's going on and advertising this as a gift to our youth. It's tragic what's happening. And alcohol, more people are dying from alcohol than the opioid crisis. People should be aware of that as well. And so we're working, I know, as an organization with the federal government currently on this issue. So I love the fact that you're engaging this and pushing it up from an urban level. So I talked about all of the initiatives in terms of harm reduction are wonderful. The importance of pushing for greater access to treatment is important. The thing I want to close with, there's a lot more I could say on this, but I think so much has been covered. You've seen today the people we have in this community. I see at a national level, I see things. There is no other community that's even close to the synergy that is happening in Ottawa on the mental health and addiction front. The work that Gord Garner is doing on stigma across the country and being asked to, the work that Rob Boyd is doing in Oasis is leading the country in terms of harm reduction. The work that Wendy Muckle is doing in Inner City Organization is amazing. The work that Kim Carrace is doing at the ROH is leading the country on this stuff. I tell you, I can see Toronto, I see Vancouver. There is nothing that's approaching what's happening here. We have an opportunity in Ottawa to become a benchmark for the rest of the country. And frankly, the world is struggling with this issue big time. It's not just Canada, and Ottawa has an opportunity here to grab this issue and run with it and make a huge impetus forward on this subject. So I just want to close by again thanking Kira and Benjamin and the people at Ottawa Public Health. Tremendous work on this and very comprehensive. And thank you so much to all the councillors and members of the board for considering this subject so deeply and spending the time on it. It's so greatly appreciated.
Thank you very much for coming out and for your support. Lots of hands going up. I'm not sure whose hand went up first, so I'll just randomly pick of the three, and we'll start with Member Kavanaugh first.
Thank you so much, Doug, for coming out tonight. I think your perspective in terms of family is really, really important to hear. We worry about the patient, but the overall effect, it has waves right through friends and family and everyone associated with that person, and how painful it is to watch somebody suffering. So I think that your organization is fantastic to bring that perspective there, and it's great to hear your take, being as you're working nationally on what we're doing in Ottawa. So yeah. I appreciate that. And, we've talked before, and the decriminalization and the fact that we're hearing such great support from people who are just got sound knowledge of the community is amazing. Yeah.
Thank you.
You're welcome. No, I appreciate that very, very much. And thank you for sharing your story. I know it's a tough one, and hopefully we can get treatment for your daughter, and that these things will evolve because of the light we're shining on these things.
Yes, exactly.
Thank you.
Thank you, Member Kavanaugh. Member Menard.
Thanks very much, Chair, and yeah, thank you so much for being here as well, Doug. Nice to hear from you on this. And I wanted to go a bit further into the decriminalization piece that you mentioned. The recommendations in our report are very strong, and I look forward to passing them today. I did want to raise with you some of the other cities around the country have been asking for a Section 56 exemption from the federal government that would decriminalize possession writ large. City of Toronto has done this. The City of Vancouver has done this, and given where we've been the last year and the effect we've had in our own city, I wonder what your thoughts are on that, with the city making a direct request as a potential for that moving forward, or if you have views on it.
Yes, I think two things. I think that the city should, first of all, ask for an exemption for Ottawa, as Montreal, Vancouver, and Toronto have, are in the process of doing. I think too, though, we should be a bit gutsy about this and just say the federal government, this is something we need to do nationally across the country, not just in this city. As a backstop, yeah, give us Ottawa, but we should be pushing to say, let's do this across the country. It's time for this change. And again, I think Ottawa is so well positioned with the people we have in the community today to be a leader in this. And I think this is a good opportunity to do that.
Thanks very much. I do note the report does advocate in that direction. And I appreciate that, and really appreciate your views. Thanks so much.
Thanks, Sean.
Member El Shantiri, please.
Thank you. Thank you, Mr. Chair, and thank you, Mr. Hunter, for your presentation and your personal touch on. I'm wondering if for someone who really support Mad Canada and who lost a close family member, my mother actually, to a drunk driver, I'm interested in a number, Mr. Hunter, when we talk about alcoholism and overdose on alcoholism. Do you have those numbers? Do you have those statistics where we can find the numbers other than Mad Canada have them?
Sorry, you mean in terms of number of deaths from alcoholism?
That's right. That's right.
I don't have them at my fingertips. I could send them to you if you want. I believe I have them in my files somewhere, but I know that number is, people don't realize there is a lot of focus on the opioid crisis, and frankly, there should be, but there's the quieter number of what's happening is that people are dying from alcoholism, but because there's so many factors, there's the liver disease, there's everything else that it drives out, and it still is, I believe, is still the higher number, but it's a bit quieter, it's less visible, and frankly, it's because it's more socially acceptable.
But the impact on the family, I'm sure you agree with me, will be equally the same.
Absolutely, it's horrendous. It's horrendous.
And I'm not sure if that question should be to you or to our staff, but being involved on a large scale, is there a consideration or a segue to involve other diverse communities? So I'm speaking of my community, the Arabic speaking community, where a lot of that stuff is a stigma, is hidden, we don't talk about it, it's a shame. Have you heard on a large stage? Is that something we need to peel it, taking a layer after layer of that onion?
Absolutely. So to start with the question about the alcohol-related statistics, I think we can go back to some work that Ottawa Public Health did around the harms from alcohol. It was a specific dedicated report, and build from there to have more conversations with the community, with diverse communities about alcohol. In this report today, you're seeing the asks for policy change at the federal level. And yes, there are many things that could be done at the federal level, as well as evaluation at the provincial level. So I think what we're looking for, again, with the statistics, the province has more of the different databases to assess the harms from alcohol in terms of what happens in the justice system, in the social services system, as well as the health system. And then there's the financial, assessments. But what we can do locally, like you've heard previously for mental health, and I think you heard some of the delegates call for more of this, we can use the data we do have locally, and we're planning to make it more visible. This is in our report. If you can see, we're looking to create something like the COVID dashboard for mental health and substance use, and then it's a way to start a conversation and conversations. So I think that addresses it, fits with what you're imagining or asking about. So.
More or less, as you know, since the pandemic, we heard from you and report from other health agency is the increase in the use of alcoholism and maybe increase in drugs as well. But one thing Doug mentioned, alcohol is still accepted. There's a sizable acceptance for alcoholism. So people they're not embarrassed to walk to a liquor store and purchase whatever they need. And so I for some reason, I don't believe we have seen the true picture of the impact of alcoholism on a diverse community as well, not specifically, but in general on a diverse community. Because, like I said, some of these discussion is very awkward, I think, on the dinner table to talk about it in some culture.
Thank you. Is there a further question, Eli?
No, I just want to say thank you to Doug for coming out and speak about this. I really appreciate it.
Thank you so much for having me today. I appreciate it.
Thank you. And we'll move to our last delegation of the night, which is a two-person delegation, Chief Peter Swilly and Superintendent Chris Renwick from Ottawa Police Services. Good morning, or not good morning, good evening, Chief. Before we get to you, though, Chief, if you don't mind, I'm going to ask for a procedural motion to be brought, because with what you're going to say, and I suspect the questions that will follow, and then questions to staff, we will go beyond 7 o'clock. So if we could quickly ask Member Kavanaugh to bring forward the motion to extend time for the meeting after 7, please, and then we can hear from the chief and the superintendent.
Thank you. Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Carrie?
Okay.
Thank you. Thank you for that indulgence, gentlemen. I don't know who's going to lead, whether it's going to be the chief or the superintendent, but 5 minutes and over to you.
Great. Thank you, Chair Eglai. Thank you, board members. Appreciate, as always, seeing Dr. Vera Etches and her team here, and my gratitude as both a public servant and resident of Ottawa for the great work that the Ottawa Public Health has done for this city and the province. I'm going to very quickly turn things over to Superintendent Chris Renwick, who is our subject matter expert on the legalization. It's been referenced a number of times by previous delegations, the position of the Canadian Association of Chiefs of Police in support of the movement. There are some always necessary elements to make sure that we get it right, both here in the nation's capital and across the country. But Chris will provide an overview of the CACP's position, which aligns with the position of the Ottawa Police Service as well. I'll provide some summary comments at the end of his presentation. But again, appreciate the opportunity to be here today with you all. Chris, over to you.
Thank you, Chief, and thank you, Board, for having us on tonight to speak to this. I'm going to focus my comments on the substance use and the overdose crisis portion of the strategy, and I think it's very much on topic, particularly with Dr. Corris's statement enlightenment to us that the most contact with persons in the community on this involves a substance abuse. First and foremost, the OPS, we do support the guiding principles of a public health approach to substance use. And it is an overdose crisis. And we, as all of you, are tracking the overdose death rates here and the 75% increase in our communities, the communities that make up the Greater Ottawa. The OPS has been a member of the Overdose Prevention Task Force since its inception. We have Staff Sergeant Jamie McGarry from our drug unit, who has been working with Kira and the task force since day one. And in our role, very much Chief's direction is the advocacy. What can we do to help support all the pillars of the strategy, from harm reduction to safe to supply, decriminalization, and just to example one of the initiatives we have underway. We're on the eve of having our frontline carrying a naloxone as a point of distribution to those in our community who need it. From the policing perspective of the strategy, as I read it, the real gem, as I see it, is the addressing of the safe supply and addressing the toxic, unregulated drug supply that our addicted community members need to turn to. That is the key from our perspective. Also from the CACP, or the Canadian Association of Chiefs of Police Drug Advisory Committee, a safe supply. And one thing we didn't hear too much about here is treatment. Those are the two policing perspective keys to address this crisis we're having. Not to minimize it, but we talk a lot about decriminalization, and we absolutely understand that the decriminalization is linked to the stigma, and the stigma, as Wendy Muckle pointed out even this evening, that the stigma is indeed killing our community members. To remove as much of the stigma as possible is the first step to a healthy approach to an addict of becoming not dependent on the drugs, and we get that. But I just want to point out that it's not a red herring in here. But we talk about decriminalization. It is important. Cities are doing it, and there's a national call for it. But let's just keep in mind here that here in Ottawa, the Ottawa Police have abandoned or stopped the practice of laying simple possession charges. We get it. The target of our drug units, the three sections of drug unit, are those traffickers who are profiting and supplying the drug to the users, and all the gunplay and community threat to community safety that goes around that. Year to date, it's just a fraction of the number of simple possession charges made by the Ottawa Police, and the majority of those charges are related charges to such as a breach of recognizance or a breach of release conditions, not to use drugs, or an impaired driving by drugs where drugs are there, and that becomes an additional charge within the trafficking or the impaired driving offense. Lastly, and I'll be very brief, just touch on harm reduction. Harm reduction is one of the pillars, and we truly recognize that the need for the supervised consumption sites. But from our perspective, we can't ignore a lot of the overwhelming burden that is placed on the communities and neighbors and businesses around those sites. One thing I really like there is the idea of smaller, more spread out, linked to treatment, linked to other services, and more share that out. We all know what's happening with the Somerset Heights community and Lower Town community, and just the concentration is creating unintended and consequences and problems in those communities. I'll leave it there. I covered a lot quickly, but again, we're absolutely, Ottawa Police are right behind the support of the public health approach, and we do welcome a Canada-wide plan. The CACP welcomes a Canada-wide plan to address this crisis. Chief, I'll turn it back to you before the questions.
Chris, thank you very much. We'll give the time over to questions or give the time back to the board.
Well, thanks for that, Chief and Superintendent. I'll start off with questions. I just want to make sure I understand your position. You certainly said that you're supportive of the report, and that's appreciated. But if I followed your train of thought, you're not. And correct me if I'm wrong, and I hope to be wrong, that you're not necessarily supportive of decriminalization. Did I get that right, or am I wrong?
No, actually, we are in support of decriminalization and the stigma, reducing the stigma. I just wanted to make the point that it's really, for all intents and purposes, here in Ottawa, we are simply as a criminal, the criminalization of a simple possession. We've moved away from that long ago, and that's just the state we're at right now.
Yeah, and I thought that had been your position, and I was following the logic, and I guess I lost the thread there for a second, and that's what you get from holding meetings through dinner time. No, I'm quite pleased to hear you confirm publicly that you are supportive of the report in its entirety, including the decriminalization piece. No, that's much appreciated, and I certainly did hear you say that you understood the stigma piece and the very lasting impact that could have on someone's life in trying to pull themselves away from the situation. It certainly can be a barrier, and I think you recognize that. And so thank you for clarifying. Much appreciated. I'm just looking to see if there are any hands up to ask questions of either the chief or the superintendent. Anybody has any questions or comments? Yes, Member Kavanaugh.
Thank you, and appreciate your support on this report, and it's very helpful. I'm wondering, in terms of the Association of Chiefs of Police, and maybe this is for Chief Slowly, have they been advocating at the federal level for this as well? Because that's where it really needs to happen. This is election day. We don't know what's going to happen, but whatever the results are, I think that we need to hear that there's going to be advocacy across the country. And I just wanted to get your comments on that.
Thank you very much, Councillor Kavanaugh. The absolute short answer is yes. Being Association of Chiefs of Police, primary advocacy responsibility is to the federal government. They've been joined by many provincial associations, including right here in Ontario, as well as our own police service. And in fact, Chris Renwick sits on our national Organized Crime Task Force, which again looks at a decriminalization harm reduction model from even that high-end enforcement. Inspector Carl Cartwright sits directly on the decriminalization task force that supports and informs the Canadian Association of Chiefs of Police. I do just want to provide one caveat, and again, it was touched on by Superintendent Chris Renwick. The support is there. What we are finding, both nationally and internationally, access to services, particularly treatment services, is a critical element in the decriminalization. And it's been stated by Chris Renwick, it's been stated by other folks, previous delegations. I just want to again reinforce that. Without that, we could create, again, unintended outcomes, unintended problems, both for the individuals, the communities, and society at large.
Fair point. We just heard an example of that from Doug Hunter, who was talking about personal situation. There's just no availability, no matter how much you're involved in advocating. However, it does help, and Ottawa is obviously hopefully Ottawa Public Health is showing we can lead the charge on this with the excellent research that's been done here and knowledge of the community. So hopefully that could be a great spot to start. Thank you.
Thank you, Member Kavanaugh. Are there any other questions or comments from board members? So seeing none, I want to thank you, gentlemen, again. As I say, I think on an issue such as decriminalization, it's significant that police at the highest level in our city have come out and spoken to that and made their position clear, that they are supportive of the public health position in this regard. So I want to thank you very much for doing that. It's much appreciated, and hopefully with you taking that position along with other police chiefs, that will carry significant weight with the people who make those decisions. So thank you for that. We'll now move to questions to staff, and again, we'll go back to the clerk's list, and so first we have Member Tilley. If you have any questions.
No, just a comment. What a great report. Well laid out, well presented tonight, and congratulations on a great effort. Let's hope this continues on up the line.
Thank you. Member Canal.
Same comment as Peter. Just great presentation. Thank you.
Member Menard.
Thanks very much, Chair. I just want to thank staff for meeting with us in the summertime on this and pushing this forward. You had said this was coming in the fall and it was going to be a comprehensive report, and you absolutely delivered on that. I appreciate the recommendations that are in here with the evidence you've provided. So just a big thank you overall. I do think it is worthwhile us pursuing across this country and following how those Section 56 exemptions work in other cities as they've requested. We just heard from our police service, maybe not as a pressing need as some other cities, for example, but certainly want to follow that thread. And I'll be voting in favor of the report, and just want to thank you again for all of your work to Ben and to Kira. Thanks very much for your help with this and your efforts.
Thank you, Member Nard. We said we'd bring it to you, and we bring it to the board, and I'm just so pleased that staff, with a very busy agenda and a very busy schedule over the last few months, were able to pull all this together. And I can't say thank you enough for that. And I know it's more than Ben and Kira, that's who we're seeing tonight, but there's a lot more people behind the scenes. And again, as I say, I can't thank you all enough for your work on this. Member Lakin.
Thanks, Chair. Absolutely. Thanks to mental health team. Very comprehensive report. Maybe useful for other board members to know. From what I understand, OPH may be the only public health body in Canada, if not Ottawa, that has a dedicated mental health strategy and as dedicated a team as we have, and certainly evident in the report how much thought's gone into it. I do have a couple questions, and hopefully they won't be complex. The first question has to do with using dashboards. In recommendation 4, there was a reference to using dashboards to monitor mental health treatment services. And I think dashboards are a fantastic surveillance method. Can we get a sort of clarification and perhaps ask if we can get close to a COVID type dashboard where we're seeing mental health outcome indicators and social determinants of health indicators on that dashboard?
You may, Chair. I'll start. And I know our lead for epidemiology isn't actually in, I don't think, on this panel to be able to answer, but certainly Kim and Kira and Ben may want to answer more. I think what we envision is something very comprehensive, because you can imagine, given the comprehensive nature of our report, we do see some of the social determinants being relevant. So we could talk about housing need and early childhood development in our dashboard that relates to mental health. We would like to cover the lifespan, as you saw, that we see impacts and needs and resilience across the lifespan. I think why I don't want to be completely definitive about its final form is because we have heard that this needs to be built in partnership with people with living expertise and experience, and with our partners. So we don't have a final product. We will build it with input. And we do have ideas, though, based on our previous work about mental health status and what framework we use as a public health lens, and then talking to some of our partners who have data as well. And I think you note, we also see that the provincial level information and health services information is of interest, and we're interested in seeing others do dashboards that could connect, just like they do for COVID. So maybe that was my initial thought. I don't know, Ben or Kira, if you want to add anything.
No, Vera, I think you covered it very well. I think that covers the board for sure.
Thanks, Dr. Etches. I had a couple other questions / comments, and I'll put it out to whoever wants to respond to it. I really liked the 5 guiding principles to the substance use health strategy. In fact, we heard from our presenters not only their endorsement, but really kind of confirming the importance of those 5 guiding principles. I would observe that there does seem to be one principle that we ought to consider and perhaps include, and that would be the principle of scientific merit. Public health initiatives are emerging, and we don't have a ton of experience with public health interventions for substance use health strategies. Not only that, it can be a fairly emotional decision-making process as to how to best develop this strategy. And so as an observation, I might note that considering the principle of using data and evaluation as a principle that guides whatever we decide on might be a useful point to come back to, and perhaps provide some comfort that it adds to the merit or the merit and validity of what we're doing. Could I just leave that for a thought and perhaps a response?
You can, and I would say that is actually one of our commitments in our strategy for Ottawa Public Health overall. So as a public health agency, we are committed to being guided by evidence, and and sometimes it's emerging evidence, or we have to create the evidence. But yeah.
I know it's implicit in the document, and I understand, of course, that it is a guiding principle of OPH work. I just want to share the concern that we've heard from our partners the essential nature of how they make their decisions about substance use health strategies, and most of them have explicitly referred to the use of best practices. And I would encourage us to consider that as something we want to just enshrine with this.
I can take that and take that back to the team as well, and we can look to add some language around specifically around using best available scientific evidence and knowledge of best practices, and the strategy will be informed by evaluation. Absolutely. So we can take that back and look to include that language in the overarching statement. That won't be an issue, and I can discuss that with the team. Absolutely.
Thanks. I think at the end of the day, it just provides some comfort in our decision making around strategies, and so thanks for that consideration. Just one last thing. As we look ahead and visualize the changes that these strategic initiatives are going to create for our community, could I just ask what staff sees as the biggest risks that emerge from this strategy, the biggest risks that emerge in successfully implementing the strategies?
Thank you for that question. It's a big question, but upon reflection of what we heard preparing for the report, working over the last decade with our partners and seeing where we're at now, the biggest risk is if we as a community, as an agency, if we do nothing, and the status quo will most certainly lead to worsened outcomes. And so we need all levels of government who are involved in supporting health and funding health to be involved in this. And if we continue to stay on the path we're on, I think that's the biggest risk. So I will add in there that funding, that risk is inevitably a part of that. So funding for social services, housing, employment initiatives, and not addressing the ongoing inequity in health services across the system. So this is about all levels of government working together. And if we don't see that change, I think that's the biggest risk to achieving success in our strategy.
Thank you. Thanks for that.
Yeah, I would have said something similar, I think in a different way, in that the risk is that we don't act comprehensively. That if we pick out one or two things and we think we're going to change the outcomes, it's unlikely. It actually takes a comprehensive approach to change outcomes related to substance use. So I think that's the risk as well, which is sort of similar to what you were saying.
Thanks to you both, and genuinely thanks to the team and to Dr. Retches for continuing to lead Ottawa down or towards a path that's unlike any other community in ensuring that mental health is part of our public health. So thanks. This is an amazing report, and thanks for everything you guys have done.
For your questions. Member Kavanaugh.
Thank you very much. Well, I really appreciated the dialogue we've had tonight on the report, and hearing the delegations that supported it. So of course we knew we've got a good product, but to hear the feedback from those who work out there in the community was really, really encouraging. So I appreciate all the work that's gone into this. And as you know, I've been pushing for this for a while. I've been it's something close to my heart, and very happy that that we're coming through. We can only keep pushing because we know we need that cooperation from the other levels of government, but it starts here. I think we can be catalysts, and I think that we can create something that's very special that is going to have an impact across the country. Thank you very much for everybody for all the work.
Thank you for your comments. Member Gower.
Yeah, thank you, Chair. It certainly has been a long day and a long meeting, but I really appreciate the updates from Kira and Benjamin. Also, the delegations we heard from this evening, in particular the first two. I mean, they all the delegations provided some useful feedback, but Supinderjit and Michelle giving us a perspective of the work that their organizations do, especially in racialized communities. I found that extremely helpful this evening. I made some notes as we went along. One thing that stood out in that report was about the importance of stable housing in our community's mental health. And I think as counselors, that's something we need to keep in mind, because we have a direct effect on the city's approach to housing and affordable housing and stable housing. And also what really stood out for me was the overall theme, I guess, was around partnerships and network, and how so many organizations and individuals have a role to play. Obviously the healthcare community, but also faith leaders, community associations, schools. So thank you for the report. What I wanted to ask was, going forward, what kind of updates should we expect as a board in terms of the progress in implementing some of these initiatives and follow-up and reporting back to us?
You're going to hear from us quarterly on our mental health and substance use strategy. It's part of the quarterly updates on our overall strategy. So now when we speak to this goal related to advancing mental health and substance use initiatives, we'll speak about these recommendations and how we're doing.
Okay, excellent. It needs to be top of mind in every conversation that we have about health and well-being in our city. So thank you, everyone. Thanks, Chair.
Thank you, Member Gower. I know it's been a long day for you and some of the other members with the transit meeting first and then this. So thank you for hanging in there with us and participating. Much appreciated. Member El Shantiri.
Thank you, Mr. Chair, and obviously a big thanks to Benjamin and Kara for the report. And it is a good day when we get all our partners agree and support what we are moving forward with. Again, Dr. Vera, I'm concerned because obviously I'll be supporting this report with all my heart. It's not a problem here, but I also would like to, follow up with you, and maybe you can direct me with some staff about the increase in alcohol consumption. I know some of my colleagues, maybe they are in the core of the city or suburban. We in a rural area, we see that more than other substance abuse. So I don't want to lose sight. We're dealing with one issue, and that's why I said it's multiple layer. And I hope we can work together and try to provide us some guidance through this item, because it's no less impact on the community and the mental health than drugs or any other abuse. But as far as the report is a great report. I'm glad to hear the diversified connection our staff made with the community. That's a good, but also it's a good day when all other agency comes on board and agree with what we are, with our approach, basically. So thank you for this, but I still like to follow up with you at some point, Dr. Atchison.
Yes, absolutely. And for the whole board, we can circulate our previous report on alcohol, and we'll be looking to specifically look at alcohol in our dashboard. It is important. Yeah.
Thank you.
Yeah, thank you for that, Member El Shantiri. I think that's an important point to make. One of the points that really stuck with me from the event, if you will, that Dr. Etches and I participated in, and Member Bannon was there as well, about substance use, is how, arbitrarily it was decided, decades and decades ago, that some substances were okay to take and some substances weren't okay to take, with very little science or evidence behind it, and alcohol ended up on one side of the fence, and certain drugs ended up on the other side of the fence, without any real thought as to the impact. So agree with you 100%. It is a problem in our community, and we need to keep talking about it. We need to keep working on it, and I think Dr. Etches and the team are absolutely committed to doing that. So it's an important discussion to have. So thanks for keeping that on our radar. To Vice Chair Di Giovanni, any questions?
No, thank you, Chair. I would like to highlight that we've heard a lot about how OPH partners and listens to the community. We heard it with Participaction. We're hearing it with this report. And so a comprehensive report, to be sure, but I think I too really enjoyed all of the speakers, because I think it really does demonstrate how OPH staff has listened and partnered, and to really understand all sides of the equation and come together with a very comprehensive report. So congratulations. I do think it also, we annually, and we get updates about the strategic direction for OPH, and so to see this bucket of work within the strategic direction start to actually take shape and see what will come to drive us forward, I think is just really exciting. So maybe I'm philosophical at this late hour after a long day, but it really was heartening to both read the report yesterday. I was surprised at the length and the in-depth nature, but then to hear the conversation today was just really great. So thank you and congratulations.
Thank you. And Member Cloutier.
And just while he's getting ready to speak, I might just reflect back to you as a board that you supported us in our orientation to learn from the community and listen to the community. Again, it is in our strategy that we're committed to community and client engagement. So I am proud of the team that you can see some feedback that they have been working on this and doing that. So yeah.
And Dr. Etches, if you could share with the staff how much we really appreciate that, and how it really does help to facilitate the conversation at the board when we know that that's taken place, I think that would be great.
And I do want to jump in, and Dr. Funnell said it so beautifully in the last presentation that Kira and I are the ones here, but there are many, many people standing beside us and with us. In particular, I do want to mention Christina Smith, who put the words together. Kira and I, again, are the ones here today, but we have incredible teams that we are so grateful to work alongside, and we're really proud of them and grateful for them. And so just wanted to share that, and thanks.
Thank you. This is one of these meetings I really wish we were all in the same room together. We could feel the energy and the positivity of this report and the impact it's going to have on our community. Hopefully, Dr. Etches keeps telling me it's going to happen one day, that we'll all be back in the same room. But like I say, it's just one of those nights, I guess, one of those situations where you would really like to all be in the same room and maybe shake some hands and thank people personally. Member Banham is up next.
Chair?
I'm sorry. That's right. It was Member Cloutier, and then Dr.
I could go after Member Banham. I'm okay with that.
No. We'll stick to Diane's list. It's the golden list, so we'll stick to it. Member Cloutier.
Thank you, Chair. And Kieran, Benjamin, thank you for your for this report and the shout out you've just given to your colleagues. Indeed, I appreciate the thought and the level that is the level of detail that's provided in the report. And I recognize the hour. I have a few questions, but I don't want to keep people too long from their families and perhaps watching election returns. But I just have a couple of questions. With respect to what was published to the mental health of Ottawa's Black communities, it's on page 16 and 17, recommendation 1.3. Can you provide an update on whether there's any analysis completed or in the works to explore the distribution of funding to organizations that are working within Ottawa's BIPOC community to ensure equitable access to funding across our frontline organizations? And also, has this been broken down into further groups, particularly Indigenous or African, Caribbean, and Black groups?
Yeah, thank you, Councillor, for that question. I can tell you that we're not aware of a formal analysis that's been completed to explore the distribution of fundings for organizations working with Ottawa's BIPOC communities. In large part because OPH is not a funder of these services, we wouldn't have the comprehensive list of who and how funds are distributed. We know that this funding role is situated with various levels of governments and outside of OPH, but we are working really closely with the Ottawa Black Mental Health Coalition and the Ottawa Aboriginal Coalition to ensure that when OPH is made aware of available funds, for example, recently the Social Service Relief Fund, we work directly with them to support them in accessing these funds. And we're also an active partner of the Ottawa Black Mental Health Coalition. And so writing letters of support, providing input into these applications to support them to be successful in these applications is really important and part of our work there. And we'll continue to advocate for these partners and bring these questions back. So I will bring this question back to the team and bring this question to the Ottawa Black Mental Health Coalition to see if we can get more information.
And I would say, I would also add that Ontario Health is the funder for most healthcare services. And what you're seeing there, I don't know how public it is, but it's discussed at many tables, so I don't think it's a secret, is a real intention in the recovery planning that one of the goals is to improve mental health and substance use services. And a lens that they are going to apply is to improve the health of Indigenous and racialized communities. And so they need to measure and they need to fund in order to get those outcomes. And so it will be interesting to see if more data emerges from the provincial level. And that's partly why we made the ask for Ontario Health to create a dashboard so that we could see more into what's happening. And, I think this is a very exciting time. I think systems can be rebuilt better after the pandemic, and to have leaders, at that level, Matt Anderson, the CEO of Ontario Health, very committed to this. I think, we are hopeful. And it comes all the way down to then what does that mean in our community? And we do have partners that we know of who would be best positioned to meet the needs of the BIPOC community. Yeah.
Thank you. Thank you both for that. Further, when OPH is supporting the development of mental health promotion programs and resources and supports, who's engaged in that development process? I'm particularly interested in knowing if community members with lived experience are engaged, and if not, is that something we can support building capacity to do?
Yes, thank you. So we work alongside and consult with a number of organizations, peer groups, particularly those with lived and living experience and expertise, networks and social services. A few examples of that we heard today: the Community Addiction Peer Support Association. Unfortunately, Sean wasn't able to be with us, but represents the Drug Users Advocacy League. On the mental health side of things, we're really proud of our work in partnership with YouthNet, a by youth for youth mental health organization out of CHEO. An example that we're really excited about, hopefully very soon to share more about with you, is the development of a virtual mental health toolkit that we're developing with CHEO and YouthNet. And it's being developed with a youth advisory group of youth with lived and living experience of mental health challenges and mental illness. So it's directly alongside and with them that we're developing this project. So everything we do is in collaboration with partners, and in particular, those with lived and living experience and expertise. So absolutely yes, and I appreciate the question. Thank you.
Thank you very much. Just a couple more. Recommendation 4.5 of the 2021-2022 highlight says, link parents and families to services to promote mental health of perinatal and postpartum women, children, and youth. Does Ottawa Public Health feel that there is sufficient service capacity to meet the ongoing demands for these services?
Thank you for that question. In working with our service delivery partners and during the consultations for this report, what we've heard from them is no. Unfortunately, there is not sufficient service capacity to meet the demands. And one of the reasons, and Dr. Etches brought it up about Ontario Health, information that's being presented to them and that was presented to us, is that the intensity of services required, so that's the intensity and the severity of what's presenting, is increasing. So that means that treatment requires longer engagement, which means that it's placing a strain on a very taxed set of providers and increasing wait times for services. We heard that from our colleague with living experience, Doug Hunter, shared that as well. So unfortunately, the answer is no, and that's why we did put forward the recommendations in the report, where we're asking for increased specialized intensive services in the community right across the lifespan. We're also seeing that with our older adult partners for geriatric psychiatry. The wait times are of concern for our community treatment providers. So we've put those recommendations forward, and we're going to be sharing them. And we hope to see some change. So unfortunately, the answer is no. But again, appreciate that question.
Well, thank you. And again, last question on the subject matter of the Community Safety and Wellbeing Plan, recommendation 4 in the report, sub-recommendations D to G. They indicate either increasing capacity or increasing access to a variety of mental health related services. And I support the recommendations. I'll support the report, of course. But I'm wondering, is there funding available to OPH or to the impacted agencies in order to achieve or to implement the recommendation? What's the path to getting that?
Right. Yeah. No, thank you. So as our partners are, so we're really committed to developing this work with them and the guiding council, as we brought up, and I'm part of the Community Safety Wellbeing Plan, and our partners who are leading this work. So, the Canadian Mental Health Association, Shepherds of Good Hope, Inner City Health, a lot of our partners who are doing the difficult work every day and leading this work alongside the Ottawa Police Services. Again, they've told us that they don't have everything that they need to do this adequately. And so that is a part of the plan, and part of our recommendations were to increase access and supports for more 24/7 crisis supports, particularly for mental health and addictions crisis, and as well for our community partners. The Ottawa Aboriginal Coalition has stated that they need more support as well as it relates to community support teams and crisis response. So certainly we are asking for all levels of government, and in particular the provincial government and Ontario Health, and they as the funders of health and social service, we really need that ability to address these emerging needs for mental health and substance use health, crisis response, overdose in Ottawa. More is needed. So certainly that's what we've put forward, and that's what we heard. And unfortunately, we aren't seeing the level of supports that are needed for our community, and we hope that we will see that development as we move forward. Thanks.
And if I may, Chair, also add that we aren't going to sit and wait and say we've put in a request for funding. Our partners and ourselves, we're going to see what can we do with our existing funding as well by working together, because there's no option, right? Like we have to find more solutions and continue to be innovative if further resources aren't coming. And I think what I hear, again, this isn't our area of expertise. This is more clinical healthcare provision that we're talking about. But what I hear some of our partners discussing is that there may be new roles and new ways of drawing on different health service providers or even social service providers or even community resources that will support mental health and be a different kind of frontline. And so just taking a look at all of the human resources and skill sets that might be needed, we may be able to accomplish more. And so I don't want people to think that we can't make improvements if we don't get all of the investments that would we do believe would make a difference too. Thanks.
Noted. Thank you. I turned off my camera because I'm getting a low bandwidth signal here, but Dr. Etches, Kira, Benjamin, and the whole team, thank you very much for this report and for the forthright answers that I got today. Thank you. Thank you, Chair.
Welcome. So last but not least,
Well, thank you. Thank you. So as Member Cloutier said, I was really happy to see the piece about perinatal mental health included. I've said this before, it often feels like new parents are often left out of the conversation, even though we know it is a huge risk factor. So I'm really happy to see it included and to further the conversation that, mentally healthy parents often lead to more successful outcomes for mental health amongst youth as well. So thank you for including that. I'm very happy to see it there. I also think that we'll be able to rely on partnerships in that area. I know that organizations like the Champlain Maternal Newborn Regional Program, at which Public Health is already a member of the Network Council, are thinking of starting up a community of practice for perinatal mental health. So I think there's already going to be some work amongst partners that will help alleviate some of the pressures on public health. I did want to talk a little bit about the conference getting to tomorrow that Chair Eglai has brought up a few times today. I just think it was so fantastic that members of our board were present, but invited was actually, the first step is getting an invitation to the table. And it was very meaningful to be invited. And then to see, Dr. Etches there and Chair Eglai there, as well as some other counselors as well. I think it was great that we were invited and participating. And it also was great that my perception was that we were playing a very good listening role. And I think that's very meaningful. And the things that I really heard were that we need to be including those lived experiences because they are the people who see the challenges, but they're also the people who see the successes. And so that was really wonderful to see. And I think it was just a building upon things that we've done in the past. I've said it at a few tables where Andrew Hendricks has given us a tour of the safe consumption site. And so they're just building blocks that keep adding to the passion and the fuel and the advocacy. So one of the things that came out of that conference was this idea of a media campaign, really around political advocacy that was telling the personal stories to help reduce stigma, including the personal stories of what success looks like and what the meaning of that is. And I just think that while I know big media campaigns are very expensive and the funding is, up to you, I do know that Ottawa Public Health's social media strategy is so strong and has such a wide viewership that it would be great if we were able to help facilitate some of that work really well, letting the community lead what those stories mean. Because I do think when we participated in what was 6 hours of this conference really focused on this topic, I think that everybody felt like the videos of shared stories really were very impactful. So I don't know if that's possible, if that's being considered, but I do know that the social media platform that Ottawa Public Health has been so great at getting messaging out into the community. That is all.
Thank you.
You can respond to that. I don't know if that was a question, but I think it was.
That's okay. I can respond by saying, because I'm happy to respond to that, is we're absolutely going to be involved, and we have plans we're developing right now with many partners that were a part of that to do just that. So we're hopefully by the next time we meet, you'll see some of those. And so I appreciate the question, because we are absolutely going to be involved in that. Thank you.
Wonderful. And then I guess the last piece is really about the importance of ending stigma. I think it's really important to focus on that. It was noted at that conference multiple times, but as a former clinician, I know that when people feel that there's a stigma associated, or, you know, in the context of being a midwife, that disclosing substance use could lead to their children being apprehended, et cetera. Like, when there is criminalization, when there is stigma, it means that people are fearful to actually discuss with their healthcare providers and with other members of the support team the true extent of what they are living with, and that leads to worse outcomes in care. So ultimately, I think that I really lend my support to focusing on stigma as a first step, and I will be supporting this report. Thank you.
Thank you very much. I don't think there's any more questions or comments. Again, I just wanted to reiterate, what great work the team has done, again, in very trying circumstances. And through the time that you were supposed to take off in the summer to make up for all the time on COVID. And I know that people did take time off, but it was still a big project to undertake. And I think you've heard the board's appreciation tonight for the work that you did, and also the community's appreciation. We didn't have one delegation that had anything really negative to say. They had a few suggestions and comments, but none that weren't urging the board as a whole to support this report. So I'll just leave it there and add my voice to that. I think absolutely this might well be the most important report we deal with this term, and I would ask for your support in it, or for it rather. I'm going to ask if we can carry this, if anybody has any concerns, let me know. But if we can carry it, that would be just wonderful.
Carried.
Thank you all so much. I'm just flipping through my notes here. That's the last item that we had to deal with. We carried all of the others. We have no in-camera items. And so I will ask Member Kavanaugh to please put forward the motion to adopt reports, please.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports entitled Reconciliation at Ottawa Public Health, A Time to Reflect, Refresh, and Reinforce Commitment, Ottawa Public Health's 2019 to 2022 Strategic Plan, Strategic Priority Relating to Mental Health and Substance Use Health, update on Ottawa Public Health work to support schools through COVID-19 and beyond, Ottawa Public Health Post-Pandemic Recovery Planning, Ottawa Public Health Strategic Plan for 2019-2022, update from quarter 2 of 2021, Office of the Auditor General, OAG 2021 Interim Audit Report Plan, and proposed audit of the pandemic response, 2021 Operating and Capital Budget, Q2, Board of Health for the City of Ottawa, Health Unit Status Report, and Performance Appraisal of Medical Officer of Health in camera. Personal matters about an identifiable individual. Reporting out date not to be reported out. Be received and adopted.
Carried. I don't believe that there are any motions requiring suspension of the rules of procedure. Are there any notices of motion for consideration at a subsequent meeting? Okay, Glenn's saying no. So Member Kavanaugh, if you could move the confirmation bylaw, please.
Okay, just a second. Sorry, I closed it.
I can read it out if you like.
Oh, it's okay. I got it.
Okay.
Okay, be resolved that confirmation bylaw number 2021-4, a bylaw of the Board of Health, the City of Ottawa Health Unit, to confirm the proceedings of the Ottawa Board of Health at its meeting of September 20, 2021 be read and passed.
Carried.
Carried.
Are there any inquiries? Okay, then the meeting is adjourned. Our next meeting is the 1st of November, back at our regular time and any media is asked to contact OPH Media at Ottawa. Meeting.
Sorry, Chair, you've just cut out. The media didn't hear that, I don't think.
Oh, I'm sorry. Any media inquiries following this meeting, please contact OPH Media at ottawa.ca. And now I'll send everybody back to their homes and they can turn on the TV and see who's winning and who's losing. Though I understand it may be several days before we have the final results. But again, thank you, everybody. This lots of good work tonight and lots of good work leading up to tonight. And I think as a board, we can be quite pleased with what we were able to pass tonight and the impact that it's going to have on our community. So thank you all very much.
Thank you.
Thank you, everyone.